might be able to hear you. Cool.
Yeah, well, like this one, that's my ear. This one. Thank you for contacting Premier Collection Services, a debt collection agency. My name is Carol. Like that. Okay. And then doing it again.
Testing, testing. Can you hear me? Zoom participants, can you hear me? Thank you. There's no votes. There's people online, but there's no voting. No. We are ready.
We're ready? Okay. Little technical stuff here, trying to get everything done. Welcome everybody to this couple days. Oh, let's say it again. Welcome everybody. This beautiful day is raining up there. We've got 11.52 hundredths up in the Wani now. And we're last year at the same time, we had 15 inches. So, but anyway, I want to thank everybody for coming. I think this is very, very important. This is this wasn't going to be my last meeting. Last Tuesday was, but since Jay and I talked, we thought we should do this emergency meeting so public can know what the stupid Sacramento did to us. So we can move on from there. Is County Council, is there any additions to the agenda?
None.
Okay, thank you. The invocation is going to be by Supervisor Rob Poitras, and Monty, Sister Essie, will you run the flag salute? Thank you.
Very good. Let's all stand. And let's pray. Father, we're thankful for the rain that you've given us. We're thankful for this season, the year coming to a close and a new year coming up, and the great celebration of the birth of your son, Jesus. We ask for your divine guidance today, for your wisdom, for a sense of unity, desire that we all work together. We ask for your wisdom to provide for the people that need the health care the most. We thank you for each one who has stepped up and have a heart for our hospital. We pray that whenever that would be, that a hospital would either continue or be reestablished to serve the people of Madera. We ask this in Christ's name, amen.
Thank you, Rob and Monty, very much. We're going to do public comment number 3, but just remember, it's not about the hospital, these public comments now. They're just for the general public, anything that's not on the agenda. It's on the agenda about the hospital, anything like that. This is not when you talk. So this is open to public comment, just regular items. Hello, Mr. Bill.
Good morning, Mr. Chairman and board members. You may rule that this is in contravention to just what you stated about why the meeting's being called. I'll begin my statement today. If you overrule that, then I will subside for later. Pertaining to the special meeting that has been called on 12/29/2022 by the chairman of the Board of Supervisors of Madera County regarding the closure of Madera Community Hospital, I am asserting and claiming the following conflicts of interest that pertain to the subject of the meeting today. Supervisor Robert Poitras has a direct conflict of interest with regards to any and all matters pertaining to any discussions and decisions regarding the Board of Supervisors in the closure or financial relief Madera Community Hospital as he simultaneously serves as a member of the Madera Community Hospital Board of Directors. I ask that he recuse himself from any discussions, debate, decisions, or vote regarding this matter. Additionally, with regards to Madera County's responsibility to provide for the provision of emergency pre-hospital care and transportation, a conflict of interest may exist between Pistoresi Ambulance Service Incorporated and its officers, Monty Pistoresi and Ted Pistoresi. Monty Pistoresi currently serves as a member of the Board of Directors of Madera Community Hospital. Ted Pistoresi has served in a similar capacity in the past. As a previous and or current financial arrangements or benefits, direct or indirect, between Pistoresi Ambulance, Madera Community Hospital, and or the County of Madera. These must be considered regarding any future agreements, contracts, or compensation offered by the Board of Supervisors of Madera County to Pistoresi Ambulance Service Incorporated. Madera County is about to endure a crisis of unpredictable consequences, where not only primary care is denied to disadvantaged and underserved populations, but everyday citizens and public agencies who must contend with the failure of emergency services result in death and disability. Thank you.
Any other public comment? Is it not about the hospital? No, we'll do that later. Okay, then this is just regular stuff. It's not on our agenda. Thank you. No other ones? Okay, no more public comment. We'll move to item number 4. I'm going to turn it over. Oh, you want to say something?
Well, do we want to address the quorum issue?
The what?
The quorum issue? Can
Oh,
county
yeah,
council
yeah.
elaborate on it?
Oh, I should have done that before that, right? County Council, can you direct us on that?
Well, a quorum is present, and so the board may proceed with business.
And it's okay with what Richie brought up about being on both boards?
Oh, excuse me. Yes, there's no issue there.
No issue? Okay. Okay, Mr. J, our CAO, Varney, will give a rundown on how we're going to be doing this today.
Okay, thank you, Mr. Chairman. For the board and for the public, just so you understand how we're trying to make this as succinct as possible, we're going to start out by talking about one of the most pressing issues, because it's going to happen in about 13 and a half hours. That's the closure of the ER. That will be followed by presentation by county department heads and department heads from other agencies that perhaps are being negatively impacted by this closure. We'll follow that with a discussion about the financials of what can and can't be done at this point. At that point, we'll also allow if representatives of the hospitals wish to comment on or add to anything that we say, just to make sure that we're quoting the right numbers. We would welcome that. And then the public comment will be at the end, and we're holding all public comment to the end because we're hopeful that some of the presentations, as we move through them, will answer your questions. So with that, we're going to kick off with those folks who are the county department heads who are going to come up and talk about the emergency department, the emergency room, and about 5150. So if all of you would come up, I think Dan Lynch is going to do the majority of the speaking, along with the sheriff and perhaps Connie.
Yeah, good morning, Mr. Chairman and board members. My name is Dan Lynch, and I'm the EMS director for the EMS agency for the County of Madera. And I want to give you a quick overview of what's happening with the hospital at this point. As you guys already know, pretty much the history of last week when we became knowledgeable of what's happening with the hospital, that things didn't work out with Trinity Health, and they went into an immediate direction of closing that hospital with setting up timelines and things like that. So the original timelines for closure of the hospital was going to be January 3rd, the morning of January 3rd or the night of January 2nd, when they declared bankruptcy. So we immediately started working with the hospital to see how we're going to do this. So their timeline was closing the emergency department on January 3rd, their L&D and all inpatient services that would bring patients to the hospital. Close their clinics on January 10th, and then close the rest of the hospital on the 17th of January. That timeline has been greatly changed over the course of what's happening. And I do have to tell you, we've been working very closely with Karen Panelli, the CEO of Madera Community, and her staff. And this is a terrible, terrible situation, but I gotta tell you, we've worked hard, and I think it's been very good in the coordination that we've had in making sure that patients are safe and patients are being taken care of as we deal with this. Currently, the hospital has a census of 22. That's all that's left in that hospital right now. Over the course of the last couple of days, Karen's staff and our staff have been working to basically discharge and transfer patients out of that hospital as quickly as possible and as safely as possible to other locations to make sure that they are provided care as we close this hospital. They had originally 6 ICU patients, and just over the course of the last probably 24 hours, we've been able to relocate 5 of those ICU patients to other areas of the region, some in Delano, some in Sacramento. So we've really had to send them other places because, as you know, the hospitals in our adjacent county in Fresno are really impacted. So there's not a whole bunch of capacity to move patients. So we've been pretty successful in moving the most critical patients out of that hospital. And so we feel like it's been a good course right now. We went into this, we had 2 plans from the EMS side of things. We had a plan of how we were going to discharge and move patients under an orderly fashion if everything was going according to plan. And then there was a secondary plan of what happens when it all goes to heck and we have to evacuate that hospital immediately. We're somewhere in the middle where because of certain things with staffing at the hospital, not showing up, quitting, or being pulled back by nurse registries, we've had to accelerate the timetable of moving patients out of that facility. And so we've been able to move most of those patients out. So the remaining 22, many of them are skilled nursing care facility patients that we're going to work to get moved to skilled nursing care facilities. Several are going to be discharged like they normally would be discharged from the hospital. And there's a couple of them are 5150 holds, psych holds, which we're going to talk about in a minute. But that's the current status of the hospital that I want to bring to your attention. The secondary part is the EMS system, because one of the big concerns, of course, when the hospital closes is that now ambulances that would normally transport to the hospital are now transporting all their patients to Fresno or to Merced. Just to put a number to that, the number were, because there's a significant number of patients that when they call for an ambulance, they already go to Fresno. So we were looking at around 13 to 14 patients a day that were still going to Madera Community. Not a big number, but it is a significant number when you think that those ambulances have to go to Fresno, and now we're going to end up with no ambulances in Madera County because, or at least in the Valley, because they're down in the Fresno hospitals. So as the EMS director and my staff, we worked with the providers, Sierra Ambulance from Oakhurst, Aaron, he's here today, and also Ted Pistoresi, to work with American Ambulance in Fresno to really put together, I think, a really solid response plan so that when levels or the number of ambulances available in the Valley, in the Madera Valley, get low to like 1 ambulance or so, that American and Sierra Ambulance have put on additional resources to help back up the Valley. So our dispatch centers are all attached. So basically, we would just relocate ambulances into Madera to make sure that the Madera coverage is adequate and that we don't go without ambulance coverage in the Valley. Because what we do know is that if we don't have ambulances available immediately, they're going to be responding from a longer ways away, which means that our firefighters are going to be on scene of some of these calls waiting for an ambulance, which takes them out of the firefighting business, which is what we need them there for. So that's what we've taken that all into account to make sure that we've got appropriate coverage from the EMS side. Now that's a temporary solution. That's not something that we're going to leave for long term. But right now it is the stopgap. We feel like we have a very strong plan to make very adequate coverage of EMS during this time. But we will have to work with county staff to see where we go in the long term and work with Pister SE Ambulance to see how do we fix the problem for the long term. So that's in the works. The other issue that we're dealing with is 5150s. 5150 is where a psych patient is put under a psychiatric hold, and it's a 72-hour hold. So if a person is found to be a danger to themselves, a danger to others, or gravely disabled, law enforcement or certain people in the county from behavioral health can place a hold on that patient for their own well-being, and place them on a hold and sent somewhere where they can get some mental health support. We have about 5 to 8 of those a day that go to Fresno, to Madera community. And those patients now will end up being transported into Fresno, which I was trying to avoid. I got to tell you, I was trying to avoid because we have enough of those folks in our hospitals holding up their emergency departments. And so I know that Connie from our Madera Behavioral Health has been working with our director of behavioral health in Fresno to come up with a better plan. Fresno did come up with some resources to send 5150s to that come from Madera to go to a crisis stabilization center instead of an emergency department, which is great. I support that plan. The one that bothers me the most is when they don't qualify to go to that and they end up in a Fresno emergency department. So those are things that right now the plan is not to change anything. They're going to go to Fresno. We got to take care of those people. The hospitals understand that this is the situation as we have it right now. So those hospitals will take those patients and deal with those psych patients and work with Madera County and that type of thing. But again, there's going to have to be a discussion, and I know Connie in our behavioral health department in Fresno they're already discussing, issues. They're just not quick issues to solve. So, I just want to make one other comment about the 5150 issue is that, a patient who's on a 5150 impacts not just the ambulance provider, but it impacts the law enforcement provider. It takes time. It takes a lot of resources to deal with 5150s in the field. And one of the issues that I've always had as the EMS director is that ambulances are used to transport those 5150s. And it just takes that ambulance out. And a lot of times they're not medical complaints, even though, they do have a health problem. They do have a medical problem until they get medically cleared. It's someone that may not necessarily need an ambulance to transport those individuals. And so when we're talking about transporting out of the Oakhurst area or even out of the Madera area when we have limited resources, that's a challenge for the EMS system. So with that, I think I'm done unless I'm supposed to talk about something else. I'll leave it there and give the mic up to somebody else, but hopefully I was helpful with the information I gave. Thank you.
Very much, Dan. Tyson.
Morning, Chairman, members of the board. It goes without saying, I'm obviously Tyson Pogue, your Madera County Sheriff. I think it goes without saying that the closure of our beloved hospital will have long-lasting negative effects on public safety. The ripple effects of this closure is going to be seen throughout the law enforcement community and our EMS system. As you know, the role of law enforcement is complex and it extends well beyond routine patrolling and taking reports. We will see impacts to nearly every division. However, the largest impacts will be to patrol, the jail, the coroner division, and the Office of Emergency Services. We have representatives from those 4 divisions who are going to give you a very brief, very high-level overview of what those impacts will look like. It's not intended to be a comprehensive summary or plan, just rather a high-level outlook on how our daily operations will change. Lieutenant Weaver is going to speak first regarding the patrol impacts, and I want to mention that in an effort not to be brief and not to be repetitive, we do have representatives from Chowchilla Police Department, Madera Police Department, the California Highway Patrol, the prisons, probation. They're all here. So keep in mind that these impacts that we're discussing affect not just the sheriff's office, but all of the law enforcement community.
Good morning, Chairman and board members. My name is Ian Weaver. I'm the patrol lieutenant for the Madera County Sheriff's Office. I'd like to discuss with you the impacts regarding the closure of Madera Community Hospital and how it will directly affect the patrol division. As Mr. Ritchie indicated, deputy sheriffs routinely interact with individuals who are suffering from a mental health crisis. When specific criteria are met, individuals are placed on a 5150 hold. This is done so that individual in crisis can receive proper mental health services. Currently, these patients are transported primarily by local ambulance providers. With the prolonged medical response times, it is unknown if the ambulance providers will continue to transport 5150 patients. If the transportation of 5150 patients to Fresno area facilities becomes a sheriff's office function, this will impact patrol operations. We estimate approximately 1 hour transport time each way to the hospital and approximately 40 minutes of processing time once at the facility. Those times are an estimate and could be drastically higher. For some stats, in 2022, the sheriff's office took 271 5150 reports. 292 were taken in 2021. Additional impacts to the patrol division. I foresee an increased deputy response to medical aid calls, 911 emergency calls, due to ambulances being unavailable. Increased response times to emergency calls for service. Those calls include immediate threat to life or property due to deputies being tasked with transporting 5150 patients to Fresno area facilities. I also foresee a potential decrease in the reporting of domestic violence, child abuse, or sexual assault crimes. Nurses and doctors are mandated reporters. Often these types of crimes are reported to the sheriff's office directly by a mandated reporter and not necessarily the victim of the crime. This closure will also impact our coroner division. At this time, I'd like to introduce Sergeant Manuel Ramirez from the coroner division to speak further to that.
Chairman, before Manny speaks, clerk of the board is trying to get our Zoom bandwidth expanded so everyone online can participate. So although we're not taking any action today, it'd be a best practice for us to take a brief break while we get that set up so that more of the online folks can join.
So we're going to take a 5-minute break. Okay, man.
Okay.
This is a public hearing. We got to, by law, we got to have it open that everybody can be on it that talks. So I don't. Madam Clerk, we got the Zoom meeting set up so a lot more people can line up.
We are up to 1,000 now, so we're good.
Yeah, we hit 100 and it just started booming. And so we had to do this. So by law, we got to let everybody have a chance. Anyway. Are you ready, Manuel? I'm sorry I had to cut you off, buddy, but
Yes, I
it's
am.
important.
We're ready?
Yep.
Good morning, board members and members of the community. My name is Manuel Ramirez. I'm a sergeant and I supervise the corner unit. I'm here to talk today about 5 topics. Over the last 3 years, there has been 547 cases documented out of Madera Community Hospital, which have fallen under our jurisdiction for the coroner's office. Out of these 547, 121 cases have directly come to our morgue facility for further investigation. Through additional investigation, 116 cases have been investigated by deputies responding to the hospital, which we were able to release to private funeral homes. With the closure of the community hospital, we anticipate these cases now will be directly to our morgue for further investigation, which will effectively double our numbers of decedents who will need to be housed at our facility and require drastic increase in investigative workload for the coroner's office staff. Currently, right now, our morgue facility, where we can house up to 27, but we're expected with the increase to face capacity issues. Right now, with the workload, we're near maximums on certain weeks. And with that, the morgue we're required to expand it to accommodate the expected increase in storage needs. Also, the increase of overall mortality rate, we're going to see that rise with travel time to other local hospitals, along with the reduction of available medical care. We expect an increased countywide mortality rate. The lack of availability of convenient medical care will cause many not to seek medical care immediately. And ultimately, it's going to increase our caseload mortality rate for Madera County, which brings up equipment concerns. With the closure, deputies now will be required to travel over a larger area. Also, operating practices in Fresno at the local hospitals require for deputy coroners to respond on a daily basis and transport the decedents possibly at one time and bring them back to the morgue for additional investigation, which would require an additional vehicle. In 2022 and up to date, we have 146 cases now that have been documented at the hospital. And with that, it's going to definitely increase our time response with our deputy coroners. So these are just some of the 5 topics that we wanted to bring that's going to definitely impact on the coroner side for the sheriff's office. And now I'd like to introduce Assistant Sheriff Brian Estes in regards to the corrections.
Thank you, Manuel.
Good morning. Brian Estes, Assistant Sheriff, discussing the impacts on our correctional facility. As you may or may not know, when arresting agencies make an arrest, they have to submit to a pre-booking screening to see the health of the arrestee. And this year, 113 times we've turned away the arresting agency, asking them to go to MCH to get the inmate basically cleared and checked out and stabilized. So now that's going to force our law enforcement partners to obviously travel into the Fresno area and see extended wait times. Typically, we're seeing 1 to 4 hours at MCH, where in Fresno we could see 4 to 8 hours of standby time and waiting. The other impact is medical treatment of our existing inmates. Obviously, we have medical staff on site, but when their ailments exceed their capabilities, we have to send those inmates out to MCH. And this year we sent 75 inmates out for that treatment. And when that happens, we have to send 2 correctional officers with that inmate until they return to the facility. And with our short staffing, we're typically running at minimum staffing at the jail. So what that causes us to do is to have to lock down certain areas of the jail for the safety of the inmates and the correctional officers. And obviously we don't want to do that too often and too much, because that leads to inmate frustration and disobedience and violence. And so the other concern with 5150s is when medical treatment and psychiatric treatment in a community deteriorates, you tend to see those individuals wind up in your correctional facilities where they don't need to be. And this presents challenges, obviously, to staff and our existing medical services. Obviously, we'll have to increase overtime and look at other options of contracting with security companies to try to meet these needs. And then also our medical staff, we're using the MCH lab for rapid testing and treatment of our existing. So we'll have to seek another contract for that. And now Lieutenant Zamudio will talk about our impact on emergency preparedness.
Good morning, Chairman and members of the board. My name is Zach Zamudio, Special Operations Lieutenant for the Sheriff. In regards to emergency planning, the impact closure of the hospital will have is the county's emergency plans must be rewritten to account for out-of-county hospital services. In regards to coordination, planning, and exercises, there will be increased time spent on preparedness with our neighboring counties as we will be relying on their hospital service. With these drills being focused on Fresno County, we will have to duplicate efforts to ensure readiness in our county here. In regards to incidents or pandemics, in the event of a major incident, the turnaround time for ambulances will be increased. This would also result in the need to establish an alternate care site being set up to care for the patients. This would be coordinated with public health to ensure there's proper staffing for the care site. These incidents would also result in mutual aid being requested more frequently when we have a major incident in Madera County. Discussing the projected needs to meet these challenges is Under Sheriff Darren McMecken. Thank you.
Good morning, Mr. Chairman, members of the board, Under Sheriff Darren McMecken. Essentially, we propose to establish a transportation unit. This unit will essentially be used to transport those individuals who are rejected at booking, or the arrestees, the inmates from the facility that need to be transported for medical care, and the 5150s. This unit, we believe, should be is comprised of 5 deputies and 10 correctional officers. This would cost essentially $1.8 million annually and require the additional 5 patrol units and 2 transport vans. And
5, did I say to 5 and the 10 or additional that we have right now?
correct.
Okay, that's what I thought you said, but I wanted to make sure that was.
And the cost of the total vehicles for the 5 patrol cars and 2 transport vans would be essentially $700,000. We believe some of these costs could be mitigated by contracting with the other local law enforcement agencies like the police departments to transport those individuals that are also rejected at the jail facility. So this concludes our presentation.
Good morning, Chairman Wheeler and members of the board. Connie Moreno-Praz, I'm the Director of Behavioral Health here in Madera County. First, I want to say thank you to Valley Children's Hospital because they're going to help us take care of our little ones, our kids and our youth. So thank you so much for that. They can see folks up to age 21, so we're very blessed to have them. I also want to thank Camarena Health and definitely Mr. Lynch, our guardian angel. He's helping us out with a very critical need of our department, which is our 5150 evaluations. So behavioral health provides mental health and substance abuse services to the most vulnerable populations in Madera County. We serve our indigent, our Medi-Cal population. We serve our homeless population, which are frequent flyers at the hospital, as Karen can attest. We have folks with substance abuse addiction issues that show up, I think 5 to 6 a day. In the last 4 months, we've done 143 5150 evaluations. So the hospital, the closure is a major, major impact for us. Definitely our forensics folks, our criminal justice folks as well. So we have been reaching out. I'm very blessed to have great partners throughout the state. So I'm reaching out to our nearby counties to establish contracts to use the different levels of care based on the client's needs. We are working with West Care as well. We have a mobile crisis team that is available 24 hours a day, 7 days a week, 365 days. They're established and we respond countywide. So we've had that in place. Our clinics are ready to go. They're equipped with staffing for us to serve the community. We are reaching out also to the new psychiatric hospital that is supposed to open in the spring, early March, and see if there's anything that we can do with the state to expedite all their approvals and hoping that they can open up on time and if not sooner. So we'll be working on that today and tomorrow. We are meeting with our partners later today just to ensure that we're covering all the different needs and ensure that we have a reasonable plan. We do anticipate some costs, as you heard, ambulance costs, you heard overtime, same with us, new contracts that we're establishing and/or amending or expanding our contracts. I do want to thank Fresno County. They were very quick to respond to us. So my peer over there, Susan Holt, I want to thank her publicly and definitely my other peers. Our homeless population, I'll be working with Maddie Mendez and her team and the other providers to ensure that we help that population as well. So we are attending to the needs and we will assure that our clients get served. We do appreciate the 5150 facility designation because that is a big issue for us. We have to have a facility that accepts our folks to be evaluated and then again to get all the contracts going. So again, I want to thank our partners for the quick collaboration meetings that we're having to attend to the needs of the community. Thank you.
Thank you, Connie. Morning.
Good morning. Good morning, Chairman and Board. So my name is Philip Mowry. I represent Central California Women's Facility Prison. The patient population that I think one of the things that
You got to talk right in there.
So one of the things that resonated with me in the previous conversations is just the utilization of emergency services. We send out approximately 50 patients a month to Madera Community Hospital. Madera Community Hospital actually has a medical guarded unit where we staff custody officers that take care of inpatients. When we talk about 50 patients that are being sent out on a monthly basis through emergency medical services, those patients, because we're a state agency, we have contracts with certain hospitals. And so CRMC will be our first hospital that we'll send to. But if CRMC goes on diversion, we will have to send them to Doctors Medical Center, which is 67 miles from the institution. And if you can imagine driving up the 99, how long that will take, that's going to take officers out of service, as well as ambulances out of service. So it just bleeds through throughout capacity and that level of care that we're providing to the community. I think that probably encapsulates the most pertinent parts of what's going to happen and how it's going to impact the prison. Thank you.
Good morning, Mr. Chairman, members of the board, Sarah Boss, Public Health Director. I have several items to go over with you this morning, including impacts to programs in public health, as well as significant impact to emergency preparedness, which Zach Zamundo also addressed. I also have a statement from Dr. Galley to read into the record for you, as well as how we're working with partners for further mitigation of what's happening in the next week and beyond, in addition to what Dan Lynch shared with you this morning. So I'll start with our department. It really is almost like disentangling ourselves in terms of partnership with the hospital for Department of Public Health. It's difficult to identify a program in our department that doesn't work with Madera Community Hospital in some way or another. The most significant impacts include programs such as that really work heavily with the hospital with regards to referrals, everything from our diabetes prevention program to our home visitation programs to our WIC program, receive a high volume of our referrals from the hospital. In fact, our home visitation program through MCH, maternal child adolescent health, 85% of those referrals come from the hospital. So we will be working diligently over the next weeks in identifying the best places in which we can still identify that population that needs those services. That's a seamless referral process, so that those individuals are not falling through the cracks and those services are maximized. We're meeting all of our contractual requirements with regards to those programs. Our lab also has revenue in terms of labs that we process on behalf of the hospital. That impact is over the last 5 years between $23,000 and $32,000 annually. And we are looking into whether or not some of those contracts could be established with Fresno hospitals. They are likely have mechanisms in place already. Our California Children's Services program serves children who are experiencing serious disability and illness, needing frequent medical care, and Madera Community Hospital is an important provider in that network of care for those kids. So again, we'll be working diligently to identify alternate providers for specific services based on the current caseload of those kids. But that will be a workload capacity issue, as well as wanting to make sure that there's no break in the service of the healthcare of these sick children. From an emergency preparedness standpoint, we really experienced the importance of Madera Community Hospital and having a local hospital for a county our size during COVID. It was really tested. But in the background with that, we also have all of the requirements that we have for our emergency preparedness grants and programs and contracts. Madera Community Hospital is written into all of those plans, is really a critical partner in our coalition in thinking through how we put those plans together. And so it will be a process to work with our hospitals in Fresno in particular. And I expect we will be working very closely with Fresno County Department of Public Health to be able to coordinate that. And our emergency operations plans will very likely be more merged with theirs to be, since it's similar providers or same providers that we would be accessing in an emergency. I do want to highlight, as I talk about Madera Community Hospital and how important they have been in our emergency response with regards to COVID. It's really difficult to describe how important it was that our local hospital stepped up to the degree that they did during COVID. And I really want to honor them, specifically Dr. Roshan, who was honored as a public health champion for how quickly he stepped forward and put in place monoclonal antibody treatment. It was significant for the community. It was the first hospital in the region to offer that treatment that really diverted individuals who are at high risk from hospitalization. And every step of the way, Madera Community Hospital, Karen Palinelli, the physicians at the hospital were in lockstep with public health and with all of the providers in providing vaccination, and certainly in terms of providing treatment, expanding the capacity of their ICU and their ER to be able to take care of the need of the community. And it is a significant loss in terms of overall infrastructure. Healthcare is not about a single hospital. When you look at a large response like that, it's coordinated. And so there will be definitely an impact to our system as a whole, which impacts our population as well as surrounding populations. I now like to read a statement that was provided by Dr. Galley. It's dated yesterday, December 28th. A statement from the California Health and Human Services Secretary, Dr. Mark Galley, on the announced closure of Madera Community Hospital. This is a difficult time for the Madera community. We are grateful to the hospitals and the healthcare providers in the region who are stepping up so that individuals and communities impacted by the announced closure of Madera Community Hospital have access to critical healthcare services. The California Health and Human Services Agency, along with our departments, will continue to work with Madera Community Hospital on their closure, and we will work with their health plan partners and county partners to ensure that members are aware of alternate providers in the community who are able to care for them, including behavioral health and primary care services. To those seeking emergency care, Community Regional Medical Center in Fresno and Clovis Community Medical Center in Clovis are accepting patients. Anyone who is not able to get access to non-urgent care can contact the Department of Managed Healthcare Help Center by calling 888-466-2219 or by visiting healthhelp.ca.gov. Additionally, Medi-Cal members can contact the Department of Healthcare Services Ombudsman Office by calling 888-452-8609. This statement came as part of an email in which the state wanted to confirm that they did not have intentions of purchasing the hospital or providing funding to the facility. In terms of ongoing closure mitigation, we've been working with our partners and Camarena Health. Paulo Soares is here and available to provide more detail. They are scaling up urgent care, primary care, and specialty care. Urgent care in particular, they have worked very quickly to extend the hours of the Almond campus urgent care to 11 p.m. Friday through Sunday of this weekend due to the holiday and because of the imminent closure of the hospital. And they are looking at long-term how they're extending hours, the capacity to do so, given the providers that are needed. And we are working very closely with Camarena Health in public health around messaging coordination to help the community better understand how to utilize urgent care versus when they need to go to the emergency room, how to utilize advice nurse hotlines for Medi-Cal health plans, CalViva and Anthem. So we will be publicizing those widely so that members of the community have access to answers to their questions about where they should go and where they should seek care that's appropriate. We are also working very closely with our other hospitals. Tim Curley is here and available to provide comment from Valley Children's. And of course, Karen is here as well. I'm now going to pass it off to Dr. Paul, who's going to talk a little bit more about the global impact to our community from a health perspective.
Thank you. Dr. Paul.
Chairman and members of the board, thank you. This is Simon Paul, Health Officer from Madera County. And clearly, as everybody has stated, it's a huge loss to our community and to the patients that's served by Madera Community Hospital, their closure. I also think it's important to point out it's very damaging to healthcare equity in this area. The patients who are going to be most affected by this closure are those who have the fewest resources and the least ability to adapt to the changes in our healthcare delivery system that this is going to cause.
Hey, Dr. Paul, talk a little bit slower. I'm writing and I'm deaf in one ear and can't hear out of the other, so sorry.
Perfect. When I think about the challenges ahead, I think of them in two groups, sort of short-term challenges and long-term challenges. For the short-term challenges, we have to be incredibly grateful to the EMS system, Dan Lynch, working closely with Karen Palinelli to work with closing the hospital, transferring patients out in a safe, reasonable manner. And he makes it sound fairly straightforward, but this is at a time when all the hospitals in the San Joaquin Valley are well over at 100% capacity. It's extremely difficult to find a location for one patient, let alone many. So we're very grateful for how well that sort of crisis management has worked, and also for their ability, the EMS system, to make sure that there's ambulance service available throughout Madera County, including, which I don't think you mentioned, working to try and post an ambulance outside of the closed emergency room for people who weren't aware, who show up and need emergency care. So short-term issues, those have been incredibly helpful. For the long term, there's obviously many challenges. There are some positives out there. As Sarah Boss mentioned, there's rural healthcare clinics are closing. There's a lot of people who are losing their care. We're incredibly fortunate that Camarena is willing to work to step up to try and keep those people and their providers in continuous care, and also to try and maintain specialty access in the area, which can easily be lost with the closure of a hospital. Long-term ambulance access is also going to be critical, and I know the EMS system is working on that as well. Long-term for the public health department, there's some pluses and minuses. One big minus is, as you know, through COVID, we received many resources through the state that we could only deploy by partnership with a hospital. For example, the monoclonal antibody treatment. Without a hospital to partner with, there are many resources that might be available to us as the public health department that we won't be able to utilize.
Can I interrupt you again? In March, I got COVID and I was getting an operation next week. called down here. He put me in touch with the hospital. I was on a Friday, and Saturday they had me come down at 9 a.m. Gave me that infusion water. I didn't even hardly get sick even. I just, I can't thank the Madera Hospital. I think maybe saved part of my life because I was fighting cancer and I was gonna get an operation, and that was, I want to thank you for that. And that's how important that is, that we have that right here. I mean, because, you know, I got to go get my operations. I hate to interrupt you, but I just, when you said that word, I remember.
No, it's an important point. And obviously we can coordinate with the Fresno hospitals and the health system there, but it is much easier and much faster and more efficient coordinating with healthcare in your own county with people who live
Absolutely.
and work in Madera. Another issue that always been is huge is linkage to care. That's obviously going to get worse. The only positive I can think of in that area is through the funding from the Board of Supervisors, we set up the mobile van units and already have funding to work on linkage to care. That's obviously going to be much more important as people who have difficulties with transportation and access are being discharged from distant hospitals with complicated follow-up plans. Looking forward, I think we're going to have to assess the needs to see what the loss of Madera Community Hospital is impacting the most. Is it labor and delivery services? Is it behavioral health services? Is it medical services to the jail? Is it, trauma care in the area? And I think to do that assessment, we're going to have to stay in close touch, obviously, with EMS, with the hospitals in Fresno, and with the providers in Madera County to see where things are really not able to be filled in gaps, so that looking ahead, we can work figuring out what resources we lost and what are the most important to sort of resuscitate, reestablish with having had the closure of Madera Community Hospital.
Thank you so much. Good morning, Debbie.
Good morning, Chairman and Board of Supervisors. Deborah Martinez, Director of Social Services. I won't reiterate what everybody's already stated. The only thing I will do is kind of allude to the fact that when we speak about 5150s, at least 3 to 4 a month, those are associated with adult protective services. These are folks that are either being neglected or abused that we're having evaluated. These are very vulnerable people. I just want to put a picture to that. And that means that we have social workers on a weekly basis, various times a week, going to the hospital to check on these individuals, which will now have to be deployed to various locations, whether it's in Merced or Fresno, obviously where transportation, time, efficiency, effectiveness, all going to be impacted in regards to that. We are concerned, obviously, that folks are not going to go and get services. They're going to be reluctant to be transported outside of the area. As a lot of these folks are very local, and so they don't want to leave Madera. So there's going to be reluctance to go, which means having to do things that are not voluntarily, and that's a problem. We are concerned that the fact that the folks that are in these hospitals outside of our area, there's going to be reduced visitations by family and friends. That affects recovery. So we're concerned about their mental states when they're in locations that are outside of their community. We also have our child welfare services that are right now we're working with the hospital in terms of making sure that we have all the medical records and all the information that was needed in terms of referrals for child abuse and that we need in terms of medical records, and those that are pending adoption and getting all the information that we need for those electronic medical records from the hospital. That's a concern. We also have a co-located eligibility worker there that in 2022, so far, they've received about 800, they've processed about 800 applications. So that means that they're on site to provide that application, to process those applications so that when folks are seeking services, there's a way to pay for it. So that benefits obviously the client and the hospital. Now that's get all dispersed. How that is actually going to get absorbed by other entities, I don't know. So those are things that we are going to have to work out. So I will just say that we will need to quickly develop relationships and processes to effectively meet the needs of our community with various agencies outside of our own. And that's going to take time. And unfortunately, that is meaning that there's going to be a negative impact to both our services and to our community, which is very, very unfortunate. Okay, thank you.
Thank you, Debbie. Morning.
Good morning. Gino Chermani, Commander with Madera Police Department. And one of the issues I would like to bring up is we're losing a safe place for our community members. Places where our most vulnerable are not able to go to be able to receive medical treatment, maybe from a criminal act. that they're not willing to come forward to or don't feel comfortable going to law enforcement. So their safe place is to go seek medical care, knowing that the medical will be a mandatory reporter and report back. Those a lot of times are domestic violence victims, victims of rape. And with that, they may go to Fresno, but the service that they're going to receive as a result will depend on our ability and our calls for service in our area. So it may be a courtesy report that's taken by Fresno PD, routed to detective units. So the length of time that that gets investigated and possible witnesses and criminal evidence that we can receive may be delayed. And so there is an impact to our resources, but really what I look at it is the impact to our citizens and our most vulnerable that are victims of criminal acts. The second thing is I would like to thank Paulo from Camarena Health for extending his services through the weekend. We have a very busy weekend in our city and our county with the celebration of New Year's Eve. But having extended care for injuries that occur to some of our personnel on staff, whether it be through use of forces or impacts, MCH was our aftercare where we take our employees who work 24/7. And as of right now, without Camarena stepping up to 11 o'clock, we would have had basically 8 to 5 services. So I appreciate them stepping up and offering those services through the community. Thank you.
Thank you, Gino.
Chairman, I think that
All public service.
concludes the department heads. I just wanted to add one thing there, that the county also works with MCH on workers' comp related items, especially on duty minor injuries, as mentioned by Commander Chermonte. So at this time, Joel and I, mostly Joel, are going to give you kind of an overview on some of the finances related to the hospital. So what we're going to do here is go over some numbers on the front end, just so that folks know what the reality of what we're facing is. And we'll start with some things that maybe the public doesn't even know. If you go all the way, I don't even know how far back it goes, but as with most state mandates, quite a while in the past, the state has mandated all hospitals to be seismically retrofitted by 2030. And there's a number of facilities at MCH that are not seismically up to the standard that the state is demanding. And I'll tell you that that's not uncommon. Throughout the San Joaquin Valley, there's many, many medical facilities on the hospital side that are not in a position to meet that seismic retrofit. I don't know absolutely, but I have been told that one of the reasons Clovis community is not moving more rapidly with its Madera campus is so that it can seismically retrofit its Clovis campuses and get them in a position to where they do meet the mandate. But this is a huge problem for every hospital. However, it doesn't make it less of an issue for us unless the legislature should determine that they can extend that time period out, or they could potentially free up money to deal with that. However, in the last legislative session, I don't think the governor was very open to that because there were some concerns on the labor side on spending that money on hospitals that were run potentially privately like our own. That's probably an issue for another day, but we do face the seismic retrofit deadline of 2030 for the hospital. If the hospital does go into bankruptcy, they can suspend their license. It doesn't have to be absolutely canceled. I don't know what it takes to go from a suspended license back to being fully open. That's probably a question better answered by Karen or others here at a later point in the meeting. However, when it comes down to just hard money, this is pretty much where we're at. So through the initial attempt to become affiliated with Trinity, Trinity has, I'll say, loaned $15 million to MCH. The agreements, as I understand it, give Trinity somewhat of a driver's seat on how to recover those. So in terms of things the county has to consider in terms of getting involved in this scenario, outside of all the obvious, we need some type of medical facility in Madera County. I think that's a given, but we're not discussing that. We're talking reality now, which is how do we pay for it? So you have $15 million of one-time money that needs to be paid back so that the hospital would have a freer course towards bringing itself out of bankruptcy. The other issue right now is the hospital faces an operational shortfall of about $2 to $2.5 million a month beyond current revenue. So if you project that out like you would your personal budget and then add some money for potential things that are over the horizons that we haven't seen yet, you're looking at the hospital needing approximately $50 to $55 million in the first year to remain or to reopen or to come out of its partly closed, partly open status. And then ongoing into the second year, you'd need $30 to $35 million. So with that, we'll have Joel's in the room, have him come up. If not, I don't know if he's joining us remotely or not.
No, he's there.
Okay. Sorry, I don't have my long distance glasses on my head, Joel, so I couldn't see back there in all the law enforcement people.
Thank you, Jay, Mr. Chairman, members of the board. I don't think I have much to add. I think we're going to play it by ear and, listen to what your board is thinking as far as directing staff to come up with. Like council had mentioned, there are no recommended actions today, but, your board can direct staff to look at options, look at avenues, just adding to the numbers of obviously what Jay had mentioned. The county does not have a hefty reserve, certainly not to the level of 55 million. But I do want to point out that the county is recipients of American Rescue Plan Act dollars that your board has fully allocated to projects in the community that are in progress. So if your board does consider some kind of package, there would need to be actions to redirect those from projects that your board has allocated on. And some of those projects are serving disadvantaged communities such as broadband access and that kind of stuff. So I just kind of want to mention that anything to that effect would require board action. And with that, Jay and I are available for any questions. Like I said, we don't necessarily have recommended actions, but we'll try our best to answer your board and the public's questions as it relates to any potential financial solution. Thank you.
Yeah, what was that number that we had in ARPA dollars?
So the current balance of the ARPA fund is $14 million. Those are fully allocated. But like I mentioned, none of those are unallocated. Those are fully allocated projects.
Right. I knew that, but I thought when you said it, I thought it said 34, and I thought we don't have that.
That was the initial allocation. Your board has already allocated it to various projects up and down the county. But the current balance is just over $14 million.
Okay. Thank you.
And should the board wish for staff to look into that further, we would also have to bring back to you the list of projects that we would have to unfund. To be frank, we would probably be contacting our partners at the city also to see what they could contribute, as MCH is a great contributor to the welfare of city residents that are also county residents.
Have we had any contact with the city about this?
We have not, because we were waiting to get direction from the board.
Okay.
And frankly, we're waiting to see where things really shake out at the hospital. We didn't want to try to start making a plan based on numbers that change, Chairman. So certainly at the end of I'm going to recommend at this point that we run through public comment, and then when public comments completed, that may be the best time for board to give us general direction on what you would like to have us bring back to you throughout the remainder of January.
Yeah. I would say that I don't know if any of the city councilmen or the mayor or anybody's here, but I sure wish that they were and listen to this, because it really affects them more than the whole county. There is some.
There's two council.
Oh, I see you. Yeah.
Yeah, I think Councilmember Gallegos is here. I'm sorry, I have not picked anyone else out of the audience, so I apologize. Jimmy was here too.
Good. Thank you. Because I don't know for sure, but I would guess 75% of the people in the Madera hospitals from the cities right here, not for the whole county. So I know that most of the ones up there head down 41. They don't turn right at 145, which never understood that, but that's where it goes. But I know living up there most of my life that we've had our emergency cares. We've never had a hospital, but we've had them shut down. And this last time when they shut down, about 4 or 5 years ago, Camarina Health stepped up, and they have one now in Oakhurst and also one in Corso. So they've really stepped up the plate. For a while, we had none. Adventist Health has one up there now too in the old medical center that used to be really running. So I know this is a problem all the way around, but it's really, the Madera Hospital is really a big hit compared to all the rest of those. And I think that we got to really work together with the city of Madera, which I'll be off of here next Monday. So it'll be up to the other board to do this. And I think every one of us is in their heart what we got to do. So, okay. Now,
So, Mr. Chairman, I just want to mention one other thing. So there are potentially things to consider, and maybe best for me to share these with you now before comment to see
okay.
what's supported and what's not. So there is not currently under state licensing the ability to build what we would consider like a super ER or something of that nature. So you may ask, well, why would we want to do that? Well, as Dr. Paul mentioned, we are going to have to determine which angle of service is the most important to the community. And as the hospital reopens, which I think we need to face the fact that the hospital in its current configuration, it's extremely highly unlikely that we'll ever return to offering all the services that it currently offers. It may someday offer different services, but I think in its current configuration, it's pretty apparent that losing $2 million a month is not sustainable, no matter how wealthy of a provider comes in and takes over. So certainly in terms of thinking about and brainstorming with the staff about what would work, if there was legislation that allowed licensing of, I'll call it a super ER, and I'm sure Dr. Paul can give you a much better description than that, but there are other states where that's allowed, and how that would generally work here would be that you would have to probably expand the ER somewhat. You'd have to expand EMS ability at the advanced level or beyond the advanced level to transport people to hospital facilities in Fresno, and that might be how it works. And then over the long run, that would be less expensive than running a complete hospital. Another option, and Supervisor Wheeler, you kind of led right into this potential idea, is the closest hospital we could find to us that faced similar circumstances was the Tulare Hospital District, which I believe their issues happened around 2017. But they were a district hospital, I believe, at that time. And so they went into bankruptcy. They suspended their license. They committed to quite a bit of public interaction and came out with financial support that allows the district to continue. We currently do not have any kind of hospital district. Certainly, there's a number of different ways a hospital district could be structured. But if we are going to, I'll just speak on behalf of the county-wide version. I think if you're going to get voters to support that, you're certainly going to have to offer something in the mountains that increases healthcare. You mentioned, it was Clovis Community, and then they left. And then Adventist had an advanced clinic there, and then they cut back to less. And fortunately, Camarena has extended their operation into the mountains, both in the core school area and definitely in the Oakhurst area, to the benefit of everyone. And so if we are going to consider some type of hospital district, it's when it comes down to convincing folks that this is good for the entire county, I believe you're going to have to include the Madera facility and a new facility of some type in the Oakhurst area.
Mariposa just in November passed their $1 sales tax, for their hospital by 70-something%. So
And part of the issue there was the John C. Fremont Hospital wasn't offering like the same level of care, say, that you would get if you drove down to St. Agnes. So
no, they don't have that much care, but at least they
have the support now.
And they got the support because they're the same thing. They have to have that hospital rebuilt by that same date, 2030, whatever it was. And so they're already planning right now on how what they're gonna build, and like you just said, what kind of services that most needed.
Right. So whatever the board would like us to look into when this meeting is complete, I would ask the board to focus on. I know our focus right now is the immediate because the hospital's going away. We're so used to it being here. And direct people that we know will be negatively affected. But if we throw 1, 3, 5, 10, or $15 million at it, and it only stays open for 4 more months, we haven't done right by the citizens. So hopefully we can look into some solutions that have long-term sustainability and will keep a good, high-quality medical facility in the county. And that is the end of what we have on the financial side. So if you certainly open to you to open it to public
Mr.
comment.
Rob, have you anything you wanted to say first?
I'll save my comments for later on.
Okay.
I just have a couple.
Okay. Letty?
Thank you.
No, I'll save my comments. I know that there's several members in the audience that would like to speak, but I do see that our Assemblywoman is in the audience, and I'd like to invite her up to share a little of what she's been doing in the background
Thank you.
since we found out a week ago about the closure. So I'd like to invite her up to speak before we really open it up to public comment.
Okay.
But thank you.
Thank you.
Good morning, Chairman and board members and to the public. Obviously, I would have liked to come and introduce myself officially as your assembly person under different circumstances, but nevertheless, I am here today because, as the supervisor mentioned, since I found out about 7 days ago, when I think a lot of folks started hearing about the imminent closure of the hospital, I've been working around the clock along with Senator Ana Caballero.
Yeah, could you state your name? We need to have that on record.
Thank you, Chairman. Esmeralda.
From Fresno.
Yeah, Esmeralda Soria, Assemblywoman for the District 27, which includes Madera, Merced, and Fresno counties.
Thank you so much.
And so we have been working very diligently. There's been a lot of catch up just to kind of get the history and context in terms of where we're at financially. We did have some very positive meetings yesterday. I think I was on the phone and on Zoom for 10 hours. We did have some good meeting with Karen, trying to see how together all of the partners are going to work to ensure that there is some type of facility that provides some type of services, maybe not to the level that they had been currently providing, but that this community deserves to have some type of hospital. And so we've been also meeting with the governor's staff and the office to try to figure out what we can do. From our conversations yesterday, I feel like there's a tremendous opportunity. I am glad to hear that there are some potential options from the county's perspective in terms of support. I know that the state continues to be committed to provide support. The senator and I believe former Assembly Member Bigelow were able to secure $5 million. We're still working on those dollars to come to Madera Hospital, but the goal is to ensure that those dollars help the hospital stay to some degree open and providing some levels of services. We are also continuing to talk to Karen. We want to see some type of plan, a financial plan to figure out what we can advocate at the state level to bring those resources and leverage them with whatever the county, as you guys mentioned, the city. We would also like to see that we all work together to bring the resources to be able to provide, a certain level of care for the most vulnerable communities that will be impacted if there is a complete closure of the hospital. So for my end, and I know I could probably just say Senator Ana Caballero, we're extremely committed. This is the one issue that I've been working on and laser focused in trying to make sure that we work together. I think that we have an incredible opportunity to seize the moment, even though today sounded kind of somber in terms of, what has to be redirected and really the challenges that are coming ahead. But I do feel that there's an incredible opportunity for all of us to work together to figure out a pathway forward to ensure that there's a true safety net here in Madera for the most vulnerable population. So I look forward to working with all of you. Continuing to be in conversations also with Madera Community Hospital to ensure that we are able to have the short-term plan understanding the long-term challenges with the revenues that were mentioned. The senator and I, along with the Hospital Association, are having some discussions in terms of what are some statewide policy issues that can be addressed in the next legislative session, addressing some of the seismic issues, medical reimbursement rates. So all of these things are on the radar. They're also going to be long-term issues that need to be addressed in order to have a true sustainable plan to ensure healthcare equity in this community. So thank you for the time. I look forward to just continuing to hear from the community, but rest assured, this is top of the issue for myself and for the senator.
Thank you so much. Anybody else you want to talk first?
No.
Okay, we're going to open up to the public. And what I want is there'll be a timer up there and we're going to hold it to 3 minutes. If you go over, I will ring the bell. Okay. So we got it, we got way over hundreds online that'll be wanting to talk. And I know a lot of you might want to talk. And I think it's very, very important topic for everyone because this affects all of us, every single one of us. Thank you. And there's a sign-in sheet. You don't have to do it until you get maybe speak. We don't hold nothing up, but please sign in and state your name and address so that we can have it on record.
Thank you. My name is Deidre Da Silva. I'm chairman of the board at Madera Community Hospital. I wanted to come forward and just maybe clear up a few things that I've heard, through the conversations. First of all, yes, at this point in time, we were losing $2.5 million per month, but that was not the case before we were hit with COVID. We were not in a deficit. We were always paying our bills. We did not have debt. And then COVID came along. And you can all imagine a business model where you're told you're going to hire this many people and you're going to pay them this amount of money. And then on top of that, you're going to be told how much you can charge for your services. It's not a working business model. We are, according to the Attorney General, we are reimbursed the lowest Medi-Cal rate in the state. And we have one of the highest Medi-Cal populations. So no business can survive when you're providing care for patients and you're paid less than what it costs you to provide that care. During COVID, we were told test, vaccinate, save lives, intubate, all these things, and we did. Karen Palinelli and her staff stepped up to the plate and saved numerous lives. I'm sure all of you know people that were affected in that way. And we were promised during that time that we were going to be reimbursed those dollars. That did not happen. And so all of our reserves were used to pay for taking care of patients that were incredibly sick during the time of COVID. So I just want to make it clear that, this isn't something that was mismanagement of funds or this was COVID and the high cost of nurses and the fact that our reimbursement rates are so low. And the combination of those things have led us here today. I too want to see the hospital stay open. And so we appreciate your time today. We appreciate you setting this special meeting up and we appreciate anything that can be done. Thank you so much.
Thank you so much. Morning.
Morning. My name is Brandon Robichaud. Thank you, Chairman, Board, for this special meeting. I'm not here to complain or what I refer to as, piss poor excuses, because it doesn't do anybody any good. But we do need to address who is at fault, which I believe she most pointedly out is COVID, because it's not the Board of Supervisors, it's not Trinity Health, it's not the state ag. It was COVID that kind of hit us hard. And as we move forward in the recovery efforts for what I hope is a temporary loss of an invaluable resource to the community, we never forget about what caused this, what really did, and what was COVID. So we focus on long-term, not just equitability, but resiliency for our community so we don't have this happen again. With that being said, I'm not here today as a concerned citizen of Madera. I'm a father first, a husband second, and a community member third. I'm here to represent my 4-year-old son, Elijah Reed Robichaud, and my 3-year-old daughter, Robin Sage Robichaud. I have a different paradigm, a different mentality than most people, than most civilians. I have a military background. I have an education in emergency management. I have different life experiences than most people have. One way to sum it up is one thing that my father has always said to me, which was plan for the worst and hope for the best. On December 14th, 10 years ago, I was deployed in Afghanistan. The worst thing happened to any parent, and 20 elementary school kids were killed in Sandy Hook, Connecticut. As a parent, I thank God every day that it didn't happen again the day before. I pray every day that it doesn't happen again today, and I hope for tomorrow. But like I said, I plan for the worst and hope for the best. I hope for tomorrow, but we have to plan for the worst. And I can't do that on my own. I can't plan for something like that where my kids are going to go to school and that's going to happen again. Unfortunately, it will. It's happened before Sandy Hook and it's going to happen again. With a tragedy such as that, seconds matter. Time matters. Having a hospital in our community close by really does matter. It's highly important. I know something's going to happen today or soon. I know it'll take some time to move forward and recover from this. But I do want the board and everybody to realize the importance of this type of resource to our community, especially an emergency management type of setting, which many of the sheriff's department and many of the professionals here today have stated. The risk to the community is going to be too large. And I hope that we can come to some type of resolution so that way we can move forward. Thank you for your time.
Thank you very much, Graham. Bill.
Okay, Mr. Chairman and members of the board, Bill Ritchie, Raymond, 45 years in healthcare in Madera County, as paramedic operations manager at one time at Pistresi Ambulance, emergency room nurse at Madera Community Hospitals, and 30 years in anesthesia. Mostly at Fresno hospitals, but have served stints at Madera Community providing anesthesia as recently as 2019. I feel very comfortable and confident based upon the emergency coverage plan that Dan Lynch from EMS proposed. My talk was going to be about my concerns of emergency services. I believe county and staff and department heads are on top of addressing this starting tonight at midnight when the hospital emergency room closes. I particularly valued Mr. Varney's financial assessment about the costs of a hospital, the debt analysis, referring to what's happened at Tulare District Hospital. It's spot on. It's things I've been looking at. I'd like to say with regards to Tulare District Hospital, the hospital didn't just close with 10 days notice. There was quite a bit of talk that went on for weeks and months prior to that closure in October 2017. They had the advantage, they are a district hospital, so they have a property tax base that can help support them. They voted a tax increase, they got the hospital back online in a year. I think considering a healthcare district hospital is an option. I think that you need to look at consolidating the Chowchilla Healthcare District, which is basically a nursing home now. It's a waste of taxpayers' money to support a 20-bed nursing home when that money was supposed to be for acute care hospital. That could be liquidated and we could form a larger healthcare district to serve Madera and the adjacent area. I believe county staff should look into critical access hospitals. These are special hospital licenses and permitting that allows for the most essential services, emergency services, basic surgery, maternity services, primarily for rural areas. There are some mileage restrictions based on how close you are to a metropolitan area. But whether we want a hospital someday on Oakhurst or renew a hospital here, look at critical access hospitals. Lastly, before we put $30 to $50 million back into this current organization, if there's some type of bailout, I do not support giving $30 to $50 million back to this hospital and the current leadership that exists. It's failed. They are not worthy of that money to try to resurrect this hospital. There needs to be new leadership. We have a former county CAO that sits on that board. We have a board of supervisor member that sits on that board that's a businessman, and we have an ambulance owner that sits on that. And the leadership has failed. Thank you for listening to my comments.
Good morning. My name is Dr. Mohammed Ashraf. I'm a cardiologist here. 42 years ago, this hospital recruited me to come here. I just finished my schooling. I was in Texas, and I was called by the CEO of this hospital and said, if you want to come and work here. And I decided to come and work here, move my family, and I've been here since then. So I can tell you the first-hand information, which some of you may not even know. We have worked very hard to bring this hospital where it was and where it's now. I mean, we may have some weaknesses, but this is another time to discuss that at this moment. There's a time to get together and try to, be proud of ourselves and try to have something. Can you imagine, if somebody wants to move over here, is he going to move over here anymore? There's no hospital here. We have delivered 50,000 babies in the last 50 years. We take care of 100,000 patients every single year in our emergency room and the clinic. We have a great time finding doctors to move here. Would anybody move here? Any doctor would move here if there's no hospital? Nobody would move here. I would move. What's going to happen? I'm a cardiologist. I take care of patients every single day in the emergency room and the ICU. If I don't have that, I'm going to stay here. I probably will because I'm too old to move. And my family is all here and they're all sitting here. My whole staff is here. I'm not going to move, but can I recruit a younger man to come and join me? They would not come here. So don't look at the short impact. Look at the long impact. Nobody's going to move to Madera. Madera will be known. This is the only county in California big enough, has no hospital, has no emergency room, has no ICU. A 97-year-old lady falls down, breaks her hip. Where is she going to go? How's it going to take? You go to the St. Agnes. I work there. I work in all the hospitals. I work in St. Agnes. I work in Fresno Community. I work in a heart hospital. I do my procedures over there. But waiting time, there are 100 patients waiting in CRMC right now in the emergency room. Is your mother, is your grandmother would be taken care of? Having a heart attack, every single moment, I'm a cardiologist, every single minute counts. The mortality is directly dependent on how long do they reach to a cardiologist. If you don't have a cardiologist here, if you don't have an emergency room here, what's going to happen? I know money is short. We don't have money, but we can all work together. I told Karen the other day, we will work free. We will not charge hospital anything. We will work free if this hospital is there. Otherwise, my office is next to the hospital. I'm going to board my windows, which I cannot look at the hospital. I've worked here for 42 years. So please, let's work together instead of blaming each other, the governor or the state or the county. We need to work together. Thank you very much.
Thank you, John.
Good morning, Chairman, members of the board. My name is Micah Flores. I'm here this morning just as a concerned citizen. I have grown up in Madera. I live here now, obviously, and we need a hospital. Personally, I had my 2 babies in Madera. My OBGYN is here in Madera. And, I have the resources to travel to Fresno for this kind of care, for my prenatal care, for my primary care physician, but I choose Madera because we live here. We should receive these services here in Madera. And I think that for those that don't have those opportunities, those are the people that I guess we should really be talking about today. But I had my 2 children at Madera Community Hospital. I received excellent care. I've had many family members, patients at the hospital who have also received excellent care. And I just think that if, as spoken previously, there sounds to be some sort of Recovery Act funds that possibly, even though they are already allocated, it sounds like there are projects that can go unfunded. I would encourage the board to really reconsider these projects, whatever they may be, because I think that the hospital and, you know, OB, surgery, mental health services in Madera County probably trump whatever other, or they at least can access a higher number of people than, you know, whatever other projects possibly we're planning on being funded. So thank you for your time. Thank you for holding this meeting, and just think about the citizens and those that, you know, we do have the option to go other places, but we choose Madera, and that's because we live here and we want to support something local. Thank you.
Thank you, Micah. Good morning, buddy.
Good morning, chair members and board members of the Madera County Supervisors. City Council District 6, Artemio Villegas. I'm just here to let you know that the mayor and city councils, the city of Madera will be looking forward to find option to bring it back in the future, of course, after these embarrassed situations, bring it back to the Madera community, or under another name and maybe a different administration, bring it back to the city of Madera. It's going to be needed. It's a lot of people, they're old. They need a second person to bring it to the doctor's appointment or whatever they need in a medical situation. Also, we have the farm laborers, low-income families. Sometimes they need more orientation, more option to get into go to the appointments needed when they need it. So we're gonna need a community hospital. We gotta look for options to bring it back. Basically, we need a community hospital in Madera. We're gonna need it.
Yeah.
Even if we right now send all the patients to Fresno, Merced, or whatever, it doesn't matter. We need it right here, closer to us, closer to the people that need it. So we got to look for those options together with the city of Madera. We all follow you guys and find better options in the near future to have that community hospital here in Madera. We are going to need it. Madera is not small. It's growing out, so we need it. And that's my comment. Thank you.
Thank you for stepping up, and I think we're looking forward to working with you guys to get this done. So, hi, Tim.
Chairman Wheeler and members of the Board of Supervisors, good morning. My name is Tim Curley, and I'm Director of Community and Government Relations at Valley Children's Healthcare. And I just want to offer a few comments regarding the situation at hand. First, Valley Children's wants to acknowledge that the closure of Madera Community Hospital is a tremendous loss to our Valley, to the Madera community, and most importantly, to the patients and families who have counted on this facility for so many years to provide excellent care. And it's also a huge loss to the employees at that facility, and we just wanted to extend our encouragement and our thoughts to them. We also wanted to reaffirm that as Central California's only pediatric primary and specialty care network, Valley Children's will continue to provide care for children from Madera County, as well as children from across the entire region, including care for children who are supported through the California Children's Services Program, the program that Sarah Boss mentioned earlier. It's a very important part of our service mix. And while we don't treat adults, we're not set up to treat adults. We're going to continue to stay in very close communication with Madera County Public Health and Madera County Behavioral Health regarding any ongoing issues impacting children created by the closure of the hospital, including how best to care for children who present with acute mental health care needs. And we want to just thank you for convening this meeting and giving us this opportunity to provide comment.
Thank you, Tim. Good morning.
Good morning. Blessings to each and every one of you, Madera County, Madera City. I stand here in dual roles. I am Anita Evans, City Councilwoman for the City of Madera, District 4, and I am also the Vice President of the League of Volunteers for the city and Madera Community Hospital. It tears our heart apart to know that we won't be sitting at the desk coming in. As the patients walk into the door, the first thing that they see and the first people that they see are our faces. We all chose to volunteer as hospital volunteers because we want the people to see someone with a loving face. When we transport patients from rooms to rooms, we escort, we go in, we pick up, we place them in the wheelchairs, and we walk them out. We have our chaplains here. These are our volunteers. Each one of us stand for a reason. We have patients that come and never leave, and our chaplains come and they pray. Each one of us has a heart. How many of you here in this room have been patients of Madera Community Hospital? How many of you have been born here? How many of you have lost family members here? We need a hospital. Standing from the city side, I do understand. I do understand the financial impact, but the city also is ready to help. We can't give a monetary amount right now, but we do not need the doors to close. And if they do, where are people going to go? I've been a patient of Madera numerous of times, and I'm sure some of you have. Think about what would Jesus do right now if he was in this situation? How would he feel about each and every one of us? We're putting a monetary value on lives. That's not what he did. He drug a cross for us. We stand here now as your volunteers that you come in and you see. I stand here as a councilwoman for District 4. In my district, I have impoverished people that live there. We gave out over 3,000 toys within the last 2 weeks. The faces that I saw, some babies came outside with shoes off. Their parents can't afford to be able to buy things for them. Think about it. What would you do if it was your family? God bless you. Take this to the heart. Amen.
Thank you, Linda.
Good morning. My name is Joyce Lane, and I am one of the chaplains there that has volunteered at Madera Community Hospital. We have made a difference. Madera Community Hospital has made a difference in Madera community. We need our hospital. I was a patient there. One evening before, I don't know, it may have been my 75th birthday, I fell, tore my rotator cuff, cracked my elbow, and I was in too much pain to be taken to Kaiser in Fresno. And my husband took me to Madera Community. They diagnosed the same diagnosis as Kaiser did when I went the following day. The hospital is needed here. We all have resources, some resources different from others. I would implore you, let's pool our resources and bring about a solution, become a help to the city of Madera Community Hospital. I've met the CEO, I've met some of the doctors, and they give their heart, they give their time. They have invested into the people of Madera, the needs of the people. I'm asking us to come together. Let's work together. Let's not abandon the city of Madera. Let's not abandon the community hospital. These people have given their lives, their hearts, their times, their prayers. Some of us may be of a different faith, but they have prayed. They give all that they have to make this a better place, to make this a safe place. When we go into the hospital, as Anita have said, we pray. We've been blessed to help those that are crossing over, to give them comfort. People need a place to come to, a hospital where people care and concerned about their welfare, not only their welfare, but their souls, their state of mind when they take their last breath. I'm saying we can do this. No, I don't have the finance, but some of us do. Let's come together, pool our resources. God bless you.
You too.
Good morning. Good morning. Good morning. Most of the board knows me, but for those who don't, I'm Gloria Brown, the outgoing president of the Madera NAACP Branch 1084. Until January 1st, I am yet the president, and I stand before you as a member of the NAACP. I'd like to read you our main mission statement. Our mission statement is to achieve equality, political rights, and social inclusion by advancing policies and practices that expand human and civil rights, eliminate discrimination, and accelerate the well-being, education, and economic security of Black people and all persons of color. And our NAACP, all persons of color, includes every living human person in this world. We're all of a color. So I am standing here to tell you, as a also former Highway Patrol dispatcher, as a former Department of Corrections, I helped open CCWF. I've been on both of those as well. Former state employee, got hurt at work. I'm retired. But as a person who has helped the community in every possible way I can, including I was the local coordinator for the Toys for Tots program for many years, giving out to children. I served over 8,000 children. But I mostly know the Madera Community Hospital. I had a sister that worked there. I had a niece and my daughter were the PBX operators. And I myself have been there several times for health issues of my own. Madera Community Hospital stands to help so many people in their well-being, as the NAACP say. As a dispatcher, I think of the distance and time that it would take from the travel for Fresno to Madera by ambulance. There is a life-threatening situation at hand, folks. We can't think about the money. We must think about the lives. Fresno and Merced are two different locations. I worked in Fresno and I worked in Merced as dispatcher. I know the time frame it'll take even at code 3 for these people to get to a medical facility to give them their life back. We can't sit here in Madera County without a hospital. We have too many good people and too many bad people. It doesn't matter. They're people. They're God's children. They need to be blessed. That hospital was opened as a Madera Community Hospital. And as a community, we must, as this community, save our hospital. I am to the point where I will give $25 a month. I don't know about anybody else. Even in the city limits at 55,000 people, that's almost $2 million there. If you go by that, and then you have county. Let everybody determine, but let's do it together and let's save our hospital. Thank you.
Thank you very much. Morning.
Good morning, board, fellow citizens. My name is Corey Valdez. I'm with the Madera Tribune, but right now I'm going to take this off. I'm going to speak to you about my being a Maderan and the importance of this hospital. Like everyone before me has mentioned, I hope we do come together, the city, board, but also the state attorney general, Rob Bonta, along with maybe Governor Newsom can get involved. We need to get the funds. Yes, it's about saving lives. If you drop dead from a heart attack, you have a better chance of surviving with the hospital. Thank God for Pistoresi ambulance. Thank God for our hospital, the doctors, the nurses, the entire medical staff, the foundation. Every single one of them have devoted their lives to saving lives, your family's life. Are they perfect? No. The last Census Bureau, Madera had 159,000 and growing. What's going to happen to us? What's the domino effect? Real estate. Who's going to, like the doctor said, who's going to want to move to Madera? I'm not, I wouldn't. Schools, Madera Unified School District. We're going to be missing out because families aren't coming to Madera. Therefore, their kids aren't going to Madera Unified School, being in Madera Unified School District. Commerce. What's going to happen to Madera? Oh, we'll be just fine. No, I don't think so. I urge the governor, the state attorney general, the board, the city, citizens to come together, find an answer, find a solution. If it's property tax, if it's sales tax, so be it. Because our families, our lives are worth it. You're worth it. At 10:46 yesterday morning, I was driving on Howard Road, coming back from the post office. I was on Yosemite and Q. All of a sudden, I saw the flashing red lights. It was Pistoresi ambulance heading out for a call. I thought, that poor soul, I sure hope he's going to be okay. Thank you for your time.
Thank you, Corey. Morning.
Mr. Chairman, supervisors, fellow citizens. I'm Father John Warburton. I'm the pastor at St. Joachim Catholic Church. And I keep hearing this theme from the other speakers, you know, the value of human life, the value of every human life. I always feel blessed and privileged to be in a chamber that proclaims that truth: in God we trust. We live in a society that's becoming more and more divided. The dominant worldview has become relativism. You have your truth, I have my truth. There is no objective or absolute truth. That's caused a lot of division and a lot of harm. My understanding of why the Trinity Corporation did not follow through with their willingness to take over that hospital and keep it going was because the Attorney General of California put forward a condition they could not go along with. And that condition had to do with the value of life. A value that, you know, I'm proud to be an American. I'm proud to work for and fight for protecting America in any way I can, because it's founded on the principle of these truths we hold to be self-evident, that all life, all men are created equal and are endowed by their creator with certain unalienable rights. Among these, life, liberty, pursuit of happiness. In the worldview of relativism, that becomes one opinion among many. And it just seems like this is the value that's at the heart of the decision. Are the inalienable right to life to be removed from human life in the womb and then to be compromised for life outside the womb, because there is a political opinion, there is an opinion that human life is only valuable if it's wanted. Human life in the womb is only valuable if the woman wants it. That same attitude is spilling over outside the womb, and it's leading to a lot of unhappiness, a lot of injustice, a lot of irreparable harm. So I ask the decision makers to really address this most important moral issue. Relativism has been called a dictatorship because the powerful, those who have political power, those who have money, can impose their opinion on others.
Thank you, Father. It's time's up.
Thank you.
Thank you so much. Morning.
Good morning.
No, no, it's not.
Oh, no, it's good afternoon now.
12:01.
Good afternoon. My name is Alex Hernandez. I am a teacher at John Adams Elementary. I'm here to inform you of a recent development regarding MUTA, the Madera Unified Teachers Association, and all of its members. About 20 minutes ago, we were notified that Blue Cross and the hospitals in Fresno Community, Clovis Community, and the Fresno Heart and Surgical Operations will be terminating their contracts. This will reduce the number of places teachers here in Madera can go for medical services. With the loss of Madera Community Hospital already on the horizon, these teachers will have to go farther and farther for their medical services, taking teachers out of the classroom. We are already experiencing a teacher shortage here at Madera Unified, which the district is working hard to litigate those negative impacts on the students. But when teachers need medical services and have to leave the county for those services, this will negatively impact your students here in Madera County. I think it needs to be addressed that a compromise should be looked into between our Attorney General and the Trinity Health Organization, who is willing to step forward and operate the hospital here in Madera County. They were willing to put forward millions of dollars to improve the infrastructure of the hospital. Without this hospital, teachers and students will be negatively impacted, and you will see that happen in the classroom. I urge all administrators in Madera County and the surrounding communities to ask the Attorney General to compromise with Trinity Health in order to seek the most positive outcome for the teachers and the students of Madera Unified. Thank you for your time.
Hey, Alex, right? I said Alex.
Yes, Alex
I
Hernandez.
missed your last name. I'm sorry.
Hernandez.
Hernandez. Thank you.
Thank you.
Thank you too. Morning.
Hi, my name is Anna Montez. I'm a radiology tech for Madera Community Hospital, and I'm very proud to say that. I just want to remind everybody here today that back in March, the first week of March 2020, out of all of San Joaquin Valley, we were the very first hospital to receive the very first COVID patient. That was very scary for all of us. Yeah, here we are because of COVID in this mess. But we were there. We never turned our backs on anybody. We put on our masks, we put on our gowns, we put on the peppers, and we went in there and did it. And from then on, it just became one patient after another after another. We would go home, practically shower at our doorsteps before we went in to our families. We were scared, but we just did it. And we continued to do it day after day after day. We put in all the hours, the extra hours, the overtime, everything we had to do just to take care of the community. And one by one, we all ended up getting COVID, but we still never turned our back. And I just want to remind people like what it would be like if Fresno regional community shut down their level 1 trauma center. What would that be like for Fresno Lake? That's almost nearly impossible to think of, but that's what it would be like for the community of Madera. You are shutting down, or we are shutting down their level 1 trauma center for them. That's imaginable, but it's happening. Lastly, I live in Fresno. And for the past a little over 5 years, I've been doing the commute to Madera community happily. Like, I choose Madera. There's so many jobs in Fresno that I could take, but I choose Madera every day. I choose Madera because I love this community. When I first started here, I didn't know Spanish. And I know a lot of Spanish to communicate with all my patients, and I love it. Like, I love Madera community. I choose that over and over. And that's all I wanted to say. I just wanted to remind you guys what Madera Community Hospital is to the Madera community. You will be taking away, or I'm not blaming anybody, but closing would be taking away their level 1 trauma center for them. Thank you.
Thank you. Morning.
Hello,
Afternoon.
good afternoon. My name is Danita Martinez, and I am the patient liaison for our hospital. I'm sorry, I'm very emotional. I've been getting a flood of phone calls from our patients here in the community. They have no idea what's going to happen, what they're going to do. We are their lifeline. So there's a lot of concerned others in the community about their elderly parents. Their concern is, again, with ambulances as well. They're saying, without us being here, if there's an emergency, what's going to happen with that time that can save their parent or their children? Now trying to have to travel to Merced or Fresno, that time delay. What if there's an accident on this freeway? That's going to be another delay to get them there. Those are some of the concerns that are coming up. I'm not sure exactly what is needed, what needs to be done. I know that money is a very big thing, but whatever you guys can do, whatever the governor, I'm not sure who can do it, but we really need this hospital here, along with the clinics. Our clinics are also another lifeline that keep our routine care for many of our patients here in Madera that don't have transportation. A lot of our Spanish-speaking patients as well. I mean, they don't have the funds to get to Fresno to be seen as well if they needed an emergency visit. I don't know, just whatever you guys can possibly do. We really, it's very important for us to have a hospital here in Madera. Thank you.
Thank you so much.
My name is Cristalina Amato. Let me know if you need me to spell it. It's very long. I am the patient and substance use navigator at Madera Community Hospital. I'm a part of a California Bridge program that is serving the substance use, homeless, those that are just struggling with mental health, addiction, and all of that. And I feel like this is a true crisis. They come to our ER to find a safe place. They walk to our ER to find a safe place when they don't know what else to do. You know, I meet them where they're at in our ER, and I help them to get that linkage to treatment, whether it be, you know, housing, getting a phone. A lot of places in Fresno, they don't take Madera County Medi-Cal. It's already so hard for me to link them to treatment. So I can only imagine crossing the county, how much harder that's going to be. I'm so sorry. I'm also very emotional. I'm not only thinking of my coworkers, the employees there, I'm thinking all across the board, all the patients, the families. Like, what are they going to do? A lot of them that we help navigate things there, they don't have transportation. They call us because they're non-English speaking. They call us to set up that transportation for them because they don't have that support at home. So I'm just thinking, what are they going to do when it comes to going to be seen in Fresno? Thank you.
Thank you very much.
Those ladies and their comments are tough acts to follow. I'm Debbie Bray with the Madera Chamber of Commerce. And so I think what I want to say first and foremost is that during COVID and before COVID, these employees and workers and contractors with Madera Community Hospital and our fine physicians have taken extremely good care of this community. And I think it's time that we turn around and take care of them. And I would like to thank Chairman Wheeler and the Board of Supervisors for calling this special meeting to provide all of us this opportunity to come forward and speak. I know it's a difficult task ahead. I think one of the things that representing a chamber that I do want to bring forward is the impacts that this will have on our small business community as well. Not so much in the short term, but in the long term. Dr. Ashrath, my good neighbor, made a really good point about his recruitment. Dr. Antwa was recruited here to Madera. I think we all know how difficult it is to recruit physicians to counties such as Madera. Now, Dr. Ashrath, you said you were old. I think you're young and young at heart especially. However, if you look at all of our fine physicians, many of them are at an age that they could retire, and they've chosen not to. They chose to stay in their professions and take care of Madera. Their staffs have been there supporting them in this community all along. And I think that in the end, that this is going to have severe impacts on them as small business. According to the American Hospital Association, for every dollar spent on goods and services by the hospital, it trickles down 3 times to our community. So in the long run, that will have an impact for all small business. We've all suffered through COVID together, but I think we all need to be a part of the healing process, and that we all, as a community, and I think whatever process that the city and the county determined to go through to try to bring healthcare back to Madera needs to involve members of the community. So on that note, I'd like to say thank you again for hosting this meeting, and thank you to all of our healthcare professionals for all that you've done, and we're going to do our best to take care of you.
Good afternoon, Chairman Wheeler, members of the board. My name is Patience Milrod. I'm a lawyer. Couple of things I just wanted to point out. I mean, obviously you have heard from your staff, your remarkable department heads who have stepped up in this, what's supposed to be a slow week at the end of the year, and figured out what the heck to do. And I salute them. I also salute all the first responders and all the people from Madera Community Hospital who worked so hard over the last few years and are basically getting shafted right now. Pardon my French, as it were. But I want to point out that the County of Madera is also a creditor of the hospital. The County of Madera has a contract, as you know, with the hospital to provide for medical care for the indigent people among your residents. And the hospital is violating that contract by going out of business and now being unavailable and failing and refusing to comply with the terms of that contract, which makes you a creditor. So when you will have a voice when the hospital goes into bankruptcy. But more concerning is that that obligation that the county contracted with the hospital to fulfill, which is to meet the county's obligations under Welfare and Institutions Code 17,000. Well, as of the moment the hospital goes out of business, you are out of business in compliance. You're out of compliance with the law. So that the services and the stop gaps and the trying to fill the holes and trying to figure out a transportation team that's going to cost the county $2 million easily, 3 almost maybe. I can't remember the numbers, but the county will be spending significant dollars to cover what Madera, the holes that Madera Community Hospital has created. So the county probably has additional claims that it can raise in bankruptcy. The question is right now, what can the county do to stay in compliance with its section 17,000 obligations, and also to the extent possible, compel the hospital to continue to serve. I mean, we understand there's $5 million that Assemblymember Soria identified. There's other potential funding from the state. There's certainly the money the county is going to spend anyway to cover the gaps. And the question is, how is that going to get best deployed? Dr. Paul told you, and you know this, that the people who are going to suffer most are going to be the people who are actually served by that, by the county and its capacity as the safety net. And you hear urgency. I know my time's up. Just give me another second. You hear urgency from the public. You feel that urgency yourselves. I assume the hospital has opened its books to you so you can verify what the financial situation is. But to the extent you can keep some services still in place right now, that meets the urgent need. So thank you for your indulgence.
Very much. Thank you.
Hi.
Now.
I know, huh? That's a tough act to follow, let me tell you, but she nailed it. I'm Cynthia Wilson, and I'm an IHSS in-home supported services care provider. I've been in this community since 2009. And I know how significantly it's going to impact all of the care providers as well as their clients that we serve, because it's up to us care providers to get our clients to and from the emergency rooms or doctor's visits and so on, take care of whatever their needs are. And I'm also understanding that it's going to impact the field workers because injuries do occur, you know, some of them life-threatening, you know, so we need to really do something on this 11th hour to make sure that this hospital is in full force and effect, to even a trauma center, you know, even if you open it to a trauma center, rapid care, urgent care, because as a Medi-Cal recipient myself, I'm forced to have to go to Fresno for medical services, and I don't have any doctors. And as of January, well, minus Dr. Ashraf. Yeah, he's my cardiologist.
Yeah.
So anyway, but he's the only doctor that I see here in Madera because he's the only one who would accept my Medi-Cal. And so there is a shining example right there. And, you know, the clinic, I'm a clinic member of the community hospital clinic right there up front in that little trailer. So, you know, I would, again, not have anybody to refer me to any of their doctors outside of Madera. And may I remind you that those dollars are going to be spent in Fresno County, not Madera County. And if every single resident or person in this room, hospital, staff members, radiology, pathology, any of those labs are getting closed down, they would all be more than happy to donate $25 a person to try to save this hospital and go up there with that extra $5 million or whatever has been already mentioned that could be tapped into. And I do understand that if we do lose our hospital over here, the county would be definitely committing against the health and welfare and safety codes. The state and federal government would place every single resident in imminent danger, and you can't do that. So anyway, or aren't supposed to be able to do that. So, so there it is right there. I urge you to keep those doors open, tap into the governor, even if you have to call him and be a pain in the rear end like me. Okay, thank you.
Thank you.
Hi, good afternoon. My name is Madiha Ashraf. I grew up in Madeira, moved back here a year ago. I actually came up here to talk about impacts a little bit on another community. I think the folks in this room have done such a good job, but I think talking about the impacts to this community, which are dire and horrible. But there's also a community of people who work at that hospital, almost 700 people, some of whom will not be paid for their work in November and December. And I want us to keep them in mind as well as we think through this bankruptcy, which looks like it's definitely happening. I don't know, maybe there's some last minute miracle, we can all pray. But some of them, like my father, can afford to see patients for free. Others who work in the kitchens and who mop the floors, they necessarily can't. And they are often part of that same community of people who are dependent on Medi-Cal and Medicare and who need us all to come together for them. I think this district hospital idea is a wonderful one. You want $25, I'll give that to you right now too. But I do think I wanted to echo the comment made by the gentleman earlier that I don't think we can go back to business as usual with this hospital. There's no doubt that Medicaid reimbursement is low. There's no doubt that COVID has destroyed many health facilities around this country, but there's also a management problem at Madera Community Hospital and an oversight problem at Madera Community Hospital. It is the first of the local hospitals to fold under the COVID burden. And I don't think we can just go back to business as usual or an infusion of cash as usual, although an infusion of cash is important. I also think that, for those who blame the Attorney General's office or Trinity, yeah, there's stuff to talk about there, but there's also just the management of the hospital itself. And we need to do better. And those in the leadership of the hospital need to do better for this community, for those who are the most dependent on this aid. And then finally, I just wanted to address one briefly, just Father John, and I spoke to him about it before he left, I think mentioned the AG's condition on reproductive care. I just wanted to clarify that's an emergency reproductive care condition. It's not a condition to require abortion. And it is consistent with federal law for any hospital that takes Medicare and Medicaid. So I don't want this to be a political issue. We need to look at what we in this community can do to take care of ourselves. And of course, we should go to the governor, we should go to the AG, we should go wherever we can for help. And I encourage the county supervisors and the city council, if you have not called the AG's office, you have not called the governor's office, I ask that you all do so. I have done so, and I'm just nobody. But you all need to do so because you're the representatives of this community and you're beholden to the people who you represent. Thank you.
Thank you.
Good morning, Wally Nishimoto, Madera citizen, Madera, lifelong citizen of Madera. I've been a member of the Madera County Hospital Trustees for almost 20 years now, hard to believe. I can tell you that we at the Board of the Trustees have done our best over the years to provide services to the citizens of Madera. It has been a struggle. We have probably the worst payer mix in the entire state. But having a medical facility here in Madera is so hugely important. My grandmother was part of the committee that built the hospital over 50 years ago. English was her second language, but she was reached out to be part of that committee, to reach out to the community, to sell a bond to build this hospital. And the hospital has always been of community members. I have been proud to serve our community through that process. COVID was the perfect storm. It literally teared apart almost every medical system in our country, impacting hospitals, staffing, everything, you name it. Early on, when we asked for help from the federal government said we sent the money to the state. When we asked the state says they sent the money to the county. When we asked the county said, well, there's no instructions that comes with the money. So we're not sure how to spend it, and we've allocated it across the board. Now that we are where we are, I applaud staff for re-examining the available ARPA funding that we can reallocate, and it sounds like the city is going to do the same thing. For those people that have criticized hospital management and trustees and such, we are a volunteer trustee organization. Nobody takes pay as part of being on the board. If you want to volunteer, you're welcome. You're welcome to be on it. We are fully accountable. We have tried to, we examine the books and look at contracts, and from my heart, we have done the best we can. Thank you.
Thank you.
Mr. Chairman, I just wanted to remind the board that from the CARES Act money, we did give the hospital $400,000, and from the ARPA money, we did give the hospital $1 million. So we have previously contributed during the COVID crisis.
Right. That's been in the last year or so, a year and a half or so.
Good morning, Chairman, members of the board. Good morning, everybody who's very, very, very concerned here. My name is John Barsotti. I've tried to sit back and just keep my mouth shut. Doesn't happen sometimes. I was a volunteer at the hospital until COVID came. They had to shut us out, and I understand that. So I haven't been able to go back, but I was there for 10 years, so we saw a lot. We saw a lot. One of my most memorable things that I did was take babies out with their moms, occasionally with their grandfather, because the mother was going back to prison. She didn't get to be with the baby. But the grandfather's in the chair, and I said, "Is this baby ready to go?" He says, "Oh yeah, go ahead." So the grandfather was in the chair, and the baby was going out with the grandfather. Very often, almost always, I would say under my breath to the baby, "Welcome to the world. I'm so sorry. I'm so sorry." Anyway, gosh, I'm confused because I've only heard rumors and rumors and rumors and rumors. And you know what I need to have is somebody to have the courage, somebody to have the courage. Was Mr. Costa here before? Did I see him, or was that I'm mistaken? Yeah. Well, anyway, let me just say that we need to know why Trinity was squashed out of this deal. That's what I need to know. We've heard previously, a couple of persons back, that it wasn't because of abortion, it's a federal thing. Well, I don't know. Trinity is making it work in St. Agnes, as I understand. That's the rumor. The paper hasn't come out yet, so I'm going to read the paper. But I'm trying to remember what my fourth grade teacher, Mrs. Short, said: "Don't believe anything you read and only half of what you see." But what I want to know is why our Governor Newsom's Attorney General squashed the possibility of the hospital staying open. It's only fair that we know the truth, the whole truth, and nothing but the truth. Thank you for your time. Thank you, John.
Good morning, buddy.
Good afternoon, Chairperson Wheeler, members of the Board of Supervisors, of Baldwin Moy. It's really times like this where it kind of, we're looking at facing a loss that kind of brings a moment of clarity. Initially, I was going to be a bit more conciliatory, but as a lawyer, we tend to sue to correct something that is wrong. I'm not going to do that. What I am going to do is offer a couple of observations. I think in terms of a roadmap, I think Tulare may not be the one we want to look at, and perhaps the Watsonville Hospital transformation is something that we want to look at. And what they did immediately was they assemble a team of key voices, major stakeholders, committed partners, and not just within the community itself, but without the community, outside of the community. And they included the usual actors, the health providers, local government, but they included additionally insurance providers and so on. And came up with a plan in terms of what they wanted to do. And one of the first steps they did was to hire a lobbyist. It didn't cost a lot of money, but the lobbyists worked Sacramento to bring down significant money as they began to plan out. Then the team, in addition to looking at and assessing what is salvageable, which I think is what people are talking about, and looking at reorganization, looking at operational changes and so on, whatever, they then went outside again and hired an expert consultant to come up with a plan of what to do in terms of developing a roadmap that is both strategic, transactional, and financially viable. And then to implement that plan. And ultimately, some of you who are familiar with what happened, it became a district hospital. And before my time runs out, I think that you can follow what happened, but I think that what I want to close with is really a cautionary advice of sorts, whatever. And that is that before this meeting adjourns, that this body needs to decide on the next meeting, like immediately, to pull together a team, not a team of just people in the county Madera, in the city Madera, in the city of Chowchilla, whatever, but outside of it, all the other communities that are impacted to begin to go forward. Thank you.
Thank you, Baldwin. And Baldwin, we have been talking to Tulare County. We had a meeting a couple of days ago with staff and our staff. The guy who was doing it is very good.
I think that if you look at and you could follow the process that the Watsonville Hospital went through, and I think it'd be instructive.
Good afternoon, Chair Wheeler and Board of Supervisors and community. I'm Cece Gallegos, Councilwoman of the City of Madera. I'd like you to just give me a few minutes to clarify some of the information that was given. Mr. Barsotti, we have met with the Attorney General, and he has been totally a partner to try to make this work, this merger work. He has done concessions. They have had a line in the sand that says 10 years, you have to keep this hospital the way it is. He really wanted this merger to work. He gave it a 5-year. They've never changed that. There's a lot of things that you need to go on the website and read his report. He has been step one trying to make this merger work. So that's important that you know that. I didn't know this after meeting with him, that Trinity put a clause in this whole merger, which was called blow up. And at any time they didn't want to be a part of this, they could blow it out of the water and be done and walk away. To me, I felt that wasn't a great condition to put in there, but that was something that they wanted. And that was, to me, an easy way out of not making this happen for some reasons that we probably will never know why. So I'm going to go on to what I wanted to say is I am Madera Community Hospital's biggest cheerleader. I've had my kids there. We've lived there with my parents being so sick. If you had their 50th year anniversary video up here, you would be amazed of everything that this hospital has done for this community in 50 years. But we are at a state of emergency right now in this county, and the city is willing to work with the county. We have Senator Caballero, Assemblyman Soya, and Congressman Costa constantly working 24/7 to try to make this merger work. But something Senator Caballero and the council has asked for almost 9 months now is a financial report. And I'm asking now, I'm putting it on record, that we would like a financial audit of the last 3 years of Madera Community Hospital. I'm a great steward of every penny that happens from this community. I watch, if you watch the council meeting, I'm watching every penny that you contribute into this city. So for me to take taxpayer money to make this work, I need some background. I need to review it. I need to look at it, to ask the questions before I give another penny, or my colleagues or the colleagues up here decide that this is something that we need to do and it's best for this community. This hospital is best for our community, but financially, we got to find out where there was that little hiccup or that management, that we can not repeat it and go forward from it. I commend everyone for the $25. I'm in. Dr. Ashkar, the doctors here have been amazing. Dr. Nas has watched all my kids grow. I could go on and on and on. Dr. Rain, who came to Madera and wasn't sure he was going to be here. But I have to tell you, thank you, community of Madera, for rallying and wanting to keep this hospital up and running. And thank you for putting this meeting together and your time.
Thank you. Good afternoon.
Good
your name?
afternoon,
Your name?
board, public. Most of you know my name. I'm Mark Toole. Been around school boards and all that stuff. Sounds like some of the funding has been what Madera Community Hospital gets. I had a procedure done Tuesday at Fresno Regional Medical Center, and I was already aware of the problem by then. And I asked them, you're going to build a hospital out in 1241. Why can't you take this over in the interim? And I was talking to one of the registered nurses, and they said, why would we want to do that when Medi-Cal is paying 20 cents on the dollar for what we get from somebody else? And the idea of the audit that the lady just said would probably show some of those problems. So, I'm okay with that. But who sets that fee for Medi-Cal? That's kind of,
Not us.
yeah, is that something that maybe can be addressed amongst that? And by the way, 1.4 million out of that funding, that's probably nothing to the hospital. Anybody on the hospital board would probably agree. So, thank you. Somebody else can have my extra minute and a half.
We don't share.
I'll take his extra minute and a half.
No,
I'll need it.
don't work it that way.
My name's Nana Falcon. I've been a nurse at Madera Community Hospital for the last 18 years. I've actually been with the hospital for 28 years. And I look out in the audience and I see a lot of my coworkers who are my family. And for this to happen to this community is wrong. It's wrong. It's not only wrong for the employees who put everything into this hospital. It's wrong for the people of this community who have nowhere else to go. I work in labor and delivery. And when I say that minutes mean lives, I'm not kidding. Minutes mean lives. We've had patients come in hemorrhaging. If they had to go to Fresno in that kind of situation, neither one would survive because it's that fast. We've had patients come in and deliver almost at our door because they're not going to make it to Fresno or Merced. I can tell you that a lot of us, speaking for myself especially, I don't care what happened. I don't care about the finances of this hospital. What we care about is the patients. What we care about is our families. And they are getting sucker punched, and it's not fair. not fair to them. So I don't know what needs to be done. I've worked with your daughter. She's amazing. I've trained her. So Madera is a good hospital. And like any hospital, we have our bad, whatever, rumors, situations, whatever. But we are a family there. This community is a family. And I can tell you that there's been nurses who've left thinking the grass is greener and have always come back. Because it's important to have this community, this family in this town. Madera will not survive. We're going to have a lot of people dying trying to get to another place. So something needs to be done. Like I said, I don't care about the finances. I don't care what happened with Trinity. I don't care who comes in and takes over. I don't care if you do an audit on the hospital to figure out where the money went. I don't care. I just want the hospital to stay open. We need the hospital. Our family needs to stay together.
Thank you, Anna. Anybody online? Oh. Okay, so
We
we're
have
gonna-
one
let's
name-
take a 5-minute potty break.
5-minute break.
Yep.
Thank you.
as bad, so. I miss Mr. Warlock's chips, though. He always used to bring it out at other meetings. Okay, are we ready to get back online? I'm gonna go online now, and if there's anyone here that still wants to say a couple of things, I'll let you get that done when I get the online's done. So we'll start with Jessica. Your name, say your name and address, and then you got 3 minutes to talk.
Hello, my name's Jessica Hurtle and address is Daly Road, Madeira, resident of Madeira, County of Madeira for the last 5.5 years. And I'm here today as a concerned citizen along with my husband, Jay. Okay. So I just wanted to say that we heard about Madeira Hospital closing about 5 days ago. And of course, my knee-jerk reaction was to get onto social media, sign petitions and annoy the heck out of Gavin Newsom, not that he's responded. Which kind of like brings me on to the point that I wanted to make about, you know, whilst we're all sitting here and discussing everything surrounding the hospital closure and all the support mechanisms that are going to be put into place, there are going to be a lot of people who aren't aware that the hospital is closing. And, you know, communication in Madeira at best is very fragmented. And I was wondering if Madeira County was going to put together kind of like a list of all the things the community can do once the hospital closes permanently, and if they're going to mail that out, because I'm pretty sure today, you know, somebody's going to have an accident and they're going to, you know, need some emergency care or attention. And, you know, what happens when they phone the emergency services. So communication, I think, is really key. Rather than looking at what's gone, we should be looking at what we need to do. And that brings me on to the other point, which is, as a member of the community, you know, the hospital has been there to help, you know, the most vulnerable members of the community and also, you know, other people. What can we as a community do to help? I think it's one of the things whereby, you know, communities, when they come together, can move mountains, whether or not it's economically, whether or not it's administrative. You know, we're here to help you as much as, you know, you're here to help us. So, you know, I'd like to offer my services in any way that I can. You know, all you need to do is ask. And yeah, it's a terrible time, but, you know, let's rally, let's try and get things sorted. And also, you know, there are, or maybe other avenues to explore, like Usima said, turning it into a teaching hospital. Yeah, that's it.
Okay, thank you, Jessica. And we're going to have some direction when we get done here. Stay tuned. Debbie Woods.
Debbie has dropped off.
Oh, she dropped off? Maybe if she can hear us, maybe you can come back on if you want to. Okay, Claudia. Can you hear us, Claudia? Did you unmute yourself? You still hooked up?
We're asking her to unmute right now.
Okay. Is there anybody else besides her? Debbie Wood.
Debbie Woods, would you go ahead?
Hello, can you hear me now?
Yes.
Thank you, board and chairman and doctors and the community in Madera Community Hospital. I just wanted to say thank you. I'm glad I came to listen to the meeting. I'm hearing Mr. Nishimoto express his heart and saying, you know, they did the best that they can. That really touched me, and I appreciate that. To Doctors Ashroff, Dr. Arain, thank you so much for pouring your lives into this community, and to the nurses and the staff at Madera Community Hospital. I've been here for 45 years, and we as a community, we say a lot about the hospital, some good, some bad, some indifferent. But you know what? You guys were there. So thank you. It's hard not to get choked up because we need this hospital. And what I wanted to say to the board is, and I think you understand it, please go forward in knowing that this is a state of emergency. We need our hospital, and the economic devastation that it could cause for Madera alone could be irreversible. Going forward, I just want to say, please keep that in mind of what an emergency this is. It's like we're in quicksand and we're reaching for one another, and we need to stabilize and get our hospital and our community back on track. Thank you for allowing me to speak, and I yield my mic.
Hey, Claudia, would you say your name and stuff? We didn't get that. I'm sorry.
That was Debbie Woods.
Oh, that was Debbie Woods? Debbie, could you say oh, that's Debbie Woods. I don't need that. Thank you.
And we
Okay.
are trying to still get Claudia unmuted. Just one moment.
Okay.
We have Arnaldo Rodriguez. Arnaldo, go ahead.
Good afternoon, Chair Cam Wheeler, members of the board, Arnoldo Rodriguez. I serve as a city manager for the city of Madera. I simply want to thank the board for taking the time today, Jay Varney, for helping to organize this meeting. I apologize for my lack of presence there. I'm currently COVID positive, so I'm quarantining at home. I'm feeling much better. But with that being said, there was some reference earlier to the city's role and the city's participation, since we too, just like county staff, since we found out or heard the unfortunate news Thursday night that the hospital was potentially going to close, we have been working around the clock alongside county staff, alongside Assemblywoman Soria, Senator Caballero. We met with the Attorney General as recently as yesterday afternoon. So there has been a lot of movement, somewhat behind the scenes. Unfortunately, it's not always, sometimes it takes time for things to come to fruition, especially because we just recently heard the news regarding the affiliation not moving forward. Our city council, as the board is aware, has not met on the issue. But with that being said, we are here today. We're as concerned as anyone else in the community. It's going to have significant impacts to city operations, to our police department, to our fire department, to our first responders. So we're obviously very concerned. So again, I do apologize for not being there in person, but we're here, we're listening to the community, and we're going to try to be as supportive as we can. Financially, we're a lot like the county. Unfortunately, we don't have deep pockets, just like the county, just like the hospital, just like our schools. And so we obviously, I think at this point, we all want to help, but then it's always challenging as well. The city of Madera, a lot like the county, did receive funding, ARPA funding. We received $23 million. We allocated 100% of that to the city sewer and water system, which is in dire need of attention. And so any potential funding from our ARPA, a lot like the county, I would have to go back to the city council and we would have to seek redirection of funds. So Ken simply wanted to put that out there. Again, Chair, Ken, thank you very much for your Ken, for hosting the meeting, Ken, for allowing me to participate. And with that, I'll turn my remaining 8 seconds over. Thank you.
Thank you, Arnaldo. We appreciate that, and I'm sorry you got the COVID, but hey, you're tough and you get over it. But it's so important we all work together with this, and I'm so glad you had 3 of your city council.
That's
Arnaldo,
Claudia.
you got a baby there? But thank you so much, and we're gonna, I think when we get done, we're gonna direct staff to have another meeting real shortly here, and so we're all gonna work together, see what we can do. So thank you so much for, you're here. You might not think you're here, but you're here on there, so that's important. Okay, did we get, is it Claudia now?
Yes, thank you so much. My name is Claudia Hernandez. I'm a resident of the County of Madera. I think we need to be talking about a big issue that everyone is, somewhat beating around the bush about. I've heard several people come up and talk about it, but they seem like they don't actually want to say what the big issue is. And that, in my opinion, is the fact that the Attorney General is making it political by requiring Trinity to give abortions. There was a lady that spoke before me. She said it was a condition to be able to accept Medi-Cal, and that can't be true because St. Agnes accepts Medi-Cal. And if it comes to the life of the mother, they will save the mother. But they will also do everything they can to save the baby, as they should. What is true is that our governor is hell-bent on making California the baby slaughterhouse capital of this country. And I'm sure that has a great impact on this decision, along with the donors that got the Attorney General and the governor elected. And Esmeralda Soria, who spoke earlier and is our supposed advocate to the state for Madera, ran her campaign on the fact that she supports murder of our most vulnerable, the babies who cannot defend themselves. So this is political. Every bit of it is. When you are at the mercy of the Attorney General and his posse who could care less about all human life. The Attorney General even put out a statement that Trinity is at fault because they couldn't meet his demands, which, let's face it, are to make small amounts of money from the Medi-Cal and to murder babies in the womb. Those are his demands. And he acts like that's nothing, that should just, they should just roll over and do as he wishes. That's all I have to say. Thank you.
Thank you. Any other online? More? Okay, anybody here want to make any closing statements before I close up the, you can get up there, Jack, roll down here. We'll bring this, I'll bring the microphone down to you. Go ahead, Stel.
Stel Manfredi, Vice Chairman of the Hospital Board, and long time, a resident of Madera County all my life. I will try to be not redundant. I want to say just 3 things how we got here so everybody's know. It was a perfect storm right around 2 years ago. One, COVID. I'm not going to rehearse the aspects of COVID. You all know the detriment it had on our society, definitely our county, and absolutely our hospital. 2, that resulted in the scarcity of nurses all over the nation, and in particular California, and in particular a rural hospital that can't pay as much as Fresno or other metropolitan areas. So we had to go to travel nurses, which is about 40%. We were paying something like $70, $80 a nurse or et cetera. When we went to travel nurses, we had to sign up to a service, et cetera, $220. They would charge us an hour and they would get around 170, 180. And so that was a scarcity of nurses. Those are the 2 short terms. The long term is an equity process. We are a county of about 60 to 65, 70% of Medi-Cal. And in addition to that, 15, 20 years ago, we were just the opposite. We had Medicare, which pays a lot more and a lot better. And then we had private pay, which is your insurances, Blue Cross, Blue Shield, et cetera, et cetera. It's almost flipped over the last 20 years. Medicare does not pay enough to get you to break even. So those 3 things over a period of time. Before that, everybody can use more money, but we were going along with a very high reputation and very well. I've been on the board about 12 years. Others have been a lot more than that. And I've used it 3 or 4 times in the last 5 years with a hip and et cetera, and a gallbladder, et cetera. So that's how we got here. And one last note on that, it has nothing, and I'm not defending the Attorney General, nor am I bashing Trinity, et cetera, but it has nothing to do with a religious factor or et cetera. That was solved the first month that we were negotiating with Trinity. Trinity had a turnaround plan, and it needed some leeway, and it needed some way to operation and turn it around. And the Attorney General had his particular aspect of what he thought. And he did give some in reference and deference to him. I'm not painting him as a sainthood, but he's also not a devil in his aspect of what his staff and he did. Basically, it was a chicken situation. Madera Community Hospital was in the middle, neither side blinked, and here we are today. Now, that's the background. What do we do? I have 2 recommendations as an individual, because this hasn't been sliced through by the Madera Community Hospital Board of Directors, et cetera. But I would say there's 2 paths I would take if I was in Mr. Varney's spot, directed by you. 1, I would form some steering committee that would go over a possible district. A district will take a minimum of 1.5 years. It has to go through LAFCO. The Board of Supervisors doesn't approve it. The City Council doesn't approve it. LAFCO by law does. You have to have a boundary study. You have to have an economic study. You have to decide, should the mountains be in it or not? Would they go to Fresno anyway? And then that will take through the environmental, through public hearings and et cetera. That would be the biggest district that has been formed in the county of Madera since LAFCO was an organization in 1964. There's other type of districts like that, Cemetery and Mosquito. Those are the 2, but they're minimal compared to this. So you'd have to have a study group and et cetera. And you'd have to have, there's nobody in this whole county that could know the knowledge behind it to form a district. And so some type of study group should decide, should we have a district? What's the economic aspect of it? How much do we need versus the money we're getting on accounts receivable and insurance, et cetera? And what is the shortfall? Do we need to make up 2 million, 5 million, or et cetera? And then once you do that and you have it studies and so on, and it goes through LAFCO and all their environmental stuff and everything, then you have to have an election of the boundary areas that you're going to say that's what it's going to serve, whatever it is. Do you leave Churchill out? Do you leave them in, et cetera, the ranchos, on and on. And then once you have a yes or no on the boundary, I mean, not boundaries, whether a district should happen under the California law and et cetera, then you have to have a revenue study, not study, but election. Should it be a parcel tax? Should it be a sales tax? I believe, if I remember my old LAFCO law, and it could change, county council is more, could opine on that later or something, but I believe the only type of tax that is not allowed is a ad valorem, a property tax. But whatever it is, then the people would vote on that. And then 1.5 years down the line, you could put something or similar of what we have, maybe not every service. The other path I would take simultaneously is I would, and that's not your direction, that's the MCH's direction, to entertain and solicit and stuff other institutions that could come in and is willing to put up whatever it is, 20, 25, 50, and take over the hospital. But it would have to be, and of course, all this has to be approved by the Attorney General. And he would have to determine, is it better to have some hospital and some organization do it, or no, we're going to do it this way, but you won't have a hospital anyway. So those 2 avenues is what I would take to some effect and do them simultaneously. Thank you. And I really didn't mean to get up.
Thank you. Anyone else? Be online. I'm shutting her down. What? We got one online?
Jessica.
Same one? Will you make it quick? We usually don't let nobody come back, so I'll give you 1 minute.
Go ahead, Jessica.
I'm Jay Hurdle, Jessica's husband. We're sharing a computer.
Okay, I'll let you, what was your name again? We'll let you go.
Jay Hurdle.
Oh, Jay, okay.
I just wanted to say that I know this is way more complicated than it sounds to the average voter. And the reason we vote for our elected officials to be in office or to handle these decisions that we can't even comprehend. And I just wanted to thank Tyson Pogue, our sheriff. And I'd like to thank our Assemblywoman, Esmeralda Soria. And the reason we vote for our people like that is so they can take this off of our hands and do the right thing. And I think they're doing a great job, and all of you in this room. Thank you.
Thank you, Jay. Okay. Any online? Any here?
That is it.
Shutting her down. Oh, you want to talk? Oh, I thought I seen your hand. Okay, we're shut down. Bring it back to the board. I'm going to let Jay give us a summary here first, and I'll get the board members their thing.
Thank you, Chairman. Out of all of this, I've kind of tried to distill it down to 4 things that kind of overlap and in some ways don't overlap. First thing was very similar to what Stell just mentioned, and these are my suggestions to you as the board of what to direct staff to do. You can take them in whole or not at all, whatever the board's preference is. The first would be to finish reviewing both the Tulare and the Watsonville hospital, not takeover models. They both became districts. Joel and I had, at least in part, read the Watsonville story, partly because our Human Resources Director, Roman Noriega, was working for a provider in that area when that happened. So he had some personal knowledge of that and had forwarded that story to us. So thank you, Roman. Perhaps you just got drafted to the committee.
Right.
Number 2 would be to continue to work with other government entities, local, state, and federal partners to try to raise some short-term funding to keep at least a portion of the hospital viable. Right now, as we started the meeting, we're definitely aware of what's already closed and what's going to be closed literally in hours. And if there was a methodology to create more availability, especially at the state level, to continue an operation while we go through this process that Stell aptly described, so I'm not going to go back through that. Also, we will need our state partners to work on any potential legislative changes that will help not only ourselves, but, we may be, I hate to say this, when I was city administrator in Chowchilla and we faced bankruptcy in 2009, I think we were first, which was no fun, but there was many people who came after us that ended up in bankruptcy. And I will say that I think on the rural hospital side, we may be first, but we are definitely not going to be the last to face this. So there's a lot of people, I think, watching to see what we do. This may be the perfect time to make those legislative changes so that other rural hospitals continue to flourish in those other communities, as well as here in Madera. The third is to request and review the Madera Community Hospital financials as part of the short-term and long-term planning. I mean, certainly we would have to do that to do our due diligence to determine if forming a hospital district is viable. Stell did a good explanation of the timeframe that it takes to form a hospital district, but at the current time, with the current options available to us, that seems to be something we should get started on reviewing sooner rather than later, because it does have some long-term viability to it. And then the fourth and final thing would be to bring back to the board in terms of which ARPA projects you have already approved for funding and which ones the board wishes or does not wish to consider reallocating the funding towards either a short-term fix, which may not be staff's recommendation. If you're going to form a hospital district, it's going to cost money and it's going to cost time in terms of negotiating, because MCH is a private entity. And when the district starts, it's going to need some money also. So those four things are my suggestions to you to have us look into. In terms of meeting, we already have just an update, not an actual action item, agendized for the January 3rd meeting. We did that in anticipation of questions coming out of this meeting. And you may recall that this coming Monday is actually a county and I think a state holiday. So we'll try to get some things together for you in the remainder of this week. But those are the four things: review which methodology of hospital district would serve us best, continue to work with all of our government partners and try to get some clear commitments maybe from the state and federal level on current or future funding. Request the MCH financials because we're going to need those to review whether it's for short-term commitments of funds or more likely in the long term for a hospital district. And then the determination of which ARPA projects are not started yet and whether the board wishes to consider redirecting that funding towards the hospital or a hospital district. Thank you.
Thank you very much. Supervisor Rob Farmer, board member for the hospital, and
all of the above. Very good. Well, thank you so much, Mr. Chairman, and want to thank everybody for being here today. It's I've been listening to a lot of comments, and it's been interesting. And I do have a perspective that many don't have, sitting not only on the Madera County Board of Supervisors, but as well as the Madera Community Hospital Board for about the last 12 to 14 years. Prior to that, I served on the foundation, served as a chairperson for a while in Madera Community Hospital. And I just wanted to point out that earlier today, somebody suggested that it would be a conflict for me to talk. And really, there's only conflicts if you get paid, if there's some kind of financial compensation. And I get paid the same thing as Don Warnock, Stella Manfredi, Deidre Da Silva, Wally Nishimoto, and every other board member, which is zero. But I will tell you that I feel rich by having served on this board. It's building relationships with this great leadership team. These names that I just mentioned, they're all, very successful people. And it's been great. And the team, the employees, the nursing staff, whoever gets a paycheck from Madera Community Hospital has just been outstanding. It's been a pleasure working and serving with you. So I wanted to put that out there, and I really did take offense to the flawed accusations about the leadership. If it's true that because a hospital is losing money, that means there's bad leadership, then you had a problem in Watsonville, in Hollister, in Tulare, in Coalinga, and right now at Kauai Delta. Apparently they've got really bad leadership there because they're losing their shirts and they're laying off people. The CAO recently sent a letter to the governor asking for more relief for Medi-Cal reimbursements. And so that would tell you something right there. And it made the news, Channel 30 News, I think it was about a week to 10 days ago. And I know Karen is on a weekly call with CAOs, and it's really gallows out there in terms of talking to everybody. And we're talking about Kauai Delta. You see them on TV, you hear about their cardiac units, you hear about what a great hospital they are, and they really are. But it's the situation we're in. Any hospital that is primarily a Medi-Cal recipient hospital in terms of reimbursements and have to pay the salaries required for traveling nurses these days, it's a recipe for disaster. I mean, there's nowhere to go but down. I mean, can you imagine $220 an hour? That's more than doctors earn. And at Madera Community Hospital, that's 40% of our nursing staff, 40%. Before COVID, I believe Karen said, there might be 1 or 2 or 3 traveling nurses or something like that here and there, maybe during the winter time when we were experiencing the flu and so forth. And we were profitable before then. But when those two factors hit, it's nothing but a spiraling vortex. And there's no room except where we are today. So again, whenever there's an accusation about our leadership, because of the situation we're in, then pretty much you have to accuse every single hospital. And think about the hospitals in Fresno, your CMCs, your St. Agnes, even Kaiser, Valley Children's. Every one of them is having an issue right now. It's a nationwide problem. And then let's talk about Trinity. We've talked about how they are kind of, some people look at them as the villain for pulling out. Well, I like to have somebody take a look at their financials and pull up the first quarter operating results. They lost $565 million. 565. Annualize that, that's over $2 billion. Now, they're an 89 hospital system, but still, you cannot continue that long in that type of a manner. So when Trinity, and again, I guess they have bad management too, because they're losing money. So they've all got bad management. So just wanted to throw that out there. So whenever, we've been in this negotiation since, I guess last spring with St. Agnes. And by the way, they were the only hospital willing to step up and even talk to us. The only one. It wasn't like we had 10 or 20 and there was these bidding wars. I'll pay 100 million. No, 125. Do I hear 150? There was nothing like that. There was one hospital willing and one hospital system willing to step up and talk to us. And we reached out to everybody. So the Attorney General gets involved, which is what they do, because technically they want to make sure that a hospital doesn't come in and take over a market and start overcharging and things of that sort. Well, this is totally the opposite. We're just looking for somebody to come in and provide a measure of care. And we understand that they're not going to be probably able to step up and provide this and that, but we were looking for efficiencies. If we've got St. Agnes in our backyard, perhaps we have, and we heard about our census, it's 22, but it's a 106 bed hospital. And most of the time we'd have 40 to 45 people. So we had excess beds. So maybe St. Agnes could use our excess beds. Maybe we could consolidate certain services. Maybe we would shut certain services down. But, in some way, some manner, they did present a proposal to the Attorney General way in advance of the Attorney General's December 15th announcement of what he would accept. And they said, this is what we'll do. And I think that you can read between the lines when you've got a hospital system that's lost $565 million in one quarter, that, they're probably not going to be able to do everything. The last thing they need is to take on another losing hospital. Let's face it, anybody here that runs a business and, is going to be looking at taking it over, you're not going to want to have your hands tied. You're going to want to have the ability to renegotiate certain rates, certain salaries, certain things to turn the hospital around, certain services. But their hands were tied with the final offer presented on December 15th. So they immediately rejected it. So, and they were not coming back to the negotiating table. So that ship has sailed. It's one of those situations where the Attorney General stole defeat out of the jaws of victory. Again, I'm not saying that they were going to provide every single service, but a measure of something. And I think I've been hearing everybody here talk about, boy, it'd sure be great at least to have something. Well, that's what they were offering. They were going to provide something, but that ship sailed because they they couldn't afford again to bring on another losing hospital. So, and Estelle said it correctly. He was talking about the reimbursements and the traveling nurses. It just turned the entire hospital system around. And one final thing I'd like to mention as far as COVID relief. There was COVID relief for hospitals only. There's a great article in the Wall Street Journal about a month ago, and I've been sharing it with certain people. Let me know if you'd like to read it. But the way that the federal government distributed COVID money was based on your revenues, based on total revenue. So if you were a money center hospital, like say a Cedars-Sinai or some hospital in New York City or some research hospital that has a $10 trillion endowment, you got a lot of money. And guess what you did with that money? You put it in your investment fund, or you bought other property, or what you did, whatever. And you probably had people who are pretty healthy that go to your hospital. The rural hospitals, they got COVID relief money, but it was just based on their revenues, and they probably had sicker people. you look in our San Joaquin Valley here and our population, I mean, there's high rates of different disease, heart disease, asthma, diabetes, and so on and so forth. It's no secret. And it's those types of conditions that led to sicker COVID situations. And we had a pretty high death rate because if you had those underlying conditions. So it's it was relief money out there, but it didn't get here. It got to the money center hospitals. It was not distributed the way it should have been distributed where it was most need. So I've got, other things to talk about, but we've all been here a long time. And I think that with the hospital board, we're going to be entering bankruptcy soon. And as we go through that process, there are certain rules regarding bankruptcy and moving forward and getting court approval. And so it's going to be a long drawn out process, but I just like to thank our county services, our community for being here today, and we're strong. We're going to figure this thing out. It's a terrible situation, but we're not going to give up. Very good. Thank you, Mr. Chairman.
Yeah, Jay, you wanted to say something about,
Chairman, I neglected to mention one other option. The sheriff and I discussed briefly yesterday evening, has anybody in the OES, Office of Emergency Services area, ever declared an emergency based on a closure of this magnitude? I guess the sheriff, if you're prepared, if you want to come up and just talk about that briefly, just for the board's information structurally. As you know, the sheriff is your director of your Office of Emergency Services. This would be very similar to how it works when we have a fire or other disaster. The sheriff would declare and then the board would adopt. So if it is determined that the sheriff wishes to, as your OES director, enter into this declaration of emergency, then we would try to bring it back to the board on Tuesday, the 3rd, for you to ratify. That agenda is already posted and this would have come up subsequent. So we would add it as a subsequent need item, most likely.
we could do it as emergency because it was posted before, so.
Yeah, the agenda for the 3rd has already been posted. Yes, sir.
Tyson.
Thank you, Chairman. After listening to the department heads, our fellow colleagues, and the input from the public, I do believe that there is a threat of imminent peril to our community. And I do believe that it likely fits the criteria for declaring a local emergency. I do want to do a little bit of follow-up after this meeting just to ensure that we do meet that threshold. But based on my preliminary research, I do believe we've done that. I'm not aware of any other county that's declared under similar circumstances. That being said, I do think that's a direction that I'm willing to go, and we'll bring it back for the board's ratification. I do want to mention that I'm not aware of any funding resources or equipment or other resources that this declaration would bring. That being said, this declaration is a formal request to our state and federal government asking for their help and their support. And I know that some of our state representatives have been extremely working hard on this issue. And so I think this furthers their ability to help us. I would ask that Dr. Paul also research declaring a potential local health emergency at the same time. I don't know what specific criteria needs to be met on that end, but I think we should definitely look into that, as well. But I do think this is going to impact public safety, our emergency medical services, our at-risk populations, and as well as our law enforcement. So I do think that it meets the criteria, and I am willing to sign that today once I confirm with county council.
And we got till Tuesday morning, you guys work something out, and I think it's very, very important that we do this. If we can declare that, because I think we got to let everybody know what the heck's going on.
Yeah, that's my intention. My intention is to have it done today.
Right. Thank you, Tyson. Thank you, Jay. Letty. Yeah. Supervisor Gonzalez.
Yes,
Oh, yeah,
thank
you got a
you.
different name now.
No, I'm still Gonzalez. I'll remain Gonzalez professionally. Thank you.
Right.
Well, thank you everybody for being here today and for sharing your public comments. The notes that I had drafted during the meeting and the direction has already been provided by our staff. So I want to make sure that we do put a working group together that includes our local and our state and our federal stakeholders so that we're all working together. We're all at the same pace. We're all in tandem together. And I think that that's what I've seen here today is that, you know, everyone wants to see some success come out of this tragedy, because it is very devastating for our community. But I feel reassured in that we have several members of our community and leaders that are willing to work together. And so thank you for that. And then the local emergency, that was my request to declare it so that we could leverage some type of funding and the ARPA funds that we could reevaluate what our priorities are. And then just the other thing that I think is very important is that there's a lot of people who don't know what's going on. So we have the ability to see what's happening on social media. We have access to the news. We have relationships with folks, but there are folks out there who have no clue that the hospital is closing. And so I think it's really important to provide some type of public outreach. And I know that Sarah alluded to sharing that information, but if we can magnify that and really put that information out there so that people aren't driving to the hospital from Fairmead and it in those 30 minutes or whatever I'm a slow driver, so whatever it takes to get there and then to find the door shut. So it's really important that we share that information with the folks out there. But I'm looking forward to the continuing discussions to really help. It is time for us to step up, and I know the county is going to be a good partner in helping our community because they deserve that. So those are my comments. Thank you, Mr. Chairman.
Thank you. Okay, I'm going to ask for some direction from the staff, from our board. There's only 3 of us here, but we can still make that decision, you know. Some of the points I want, first of all, I want to thank everyone to be part of this discussion and where we go from here. It's so important that everybody's involved with this. And, when Jay called me last week and they'd had a meeting that day or the day before with the hospital, said they were going to close. And boy, I said, well, this is really crazy. He says, what do you think about a special meeting? I said, absolutely, we can do that. Or as long as we give 72-hour notice. And so here we are today. And I think it's important that we keep inviting, like Letty just said, there's a lot of people don't know about this. We need to get everybody out there to know it. I see Jack from his is here, Porter from his news deal. Wendy Alexander was here. We had some TV stations. We need to invite them all for next Tuesday. And especially if we can do that emergency declaration, I think that's very important. And myself, I think everyone should write the governor and AG and tell them they're full of it up to here. And and I know Dr. he left now, but he was talking about what happens to people. My ex-wife is a realtor for 40 years up there, and there's 3 things that people always ask when they come to a community. What's the school? Is probably number 1. Number 2 is the public safety. And number 3, what kind of medical services have you got? You know, for the last 20 years, at least, we've had it shut down, completely nothing up there at Oakhurst. And when the mill shut down, we actually had doctors and everything in Norfolk too, but the mill shut down, we lost our drugstore, doctors and everything. But people don't realize how bad that is until you've lived it, and I've lived it. And so when people ask about that, and then they find out we haven't got a hospital here too. And we're probably in the top 10 in new buildings Madera County than all the per population in the whole state, because we've tried to really promote Madera County, and what it's done is really helped us. We got a full paid now every position at the sheriff's department. We got fire. We're added 2 fire trucks a year for 5 years now. We're doing all that, and most of that money is coming from those new developments out there. And some people think that they don't pay their way. They pay their way. They pay for all that. They pay for the fire. They pay for the sheriff. Everything's out there paid for by them. Past supervisors didn't put much of that in new development, and it cost us. We have 140 special districts in Madera County, 120 are in my district, which I'm retiring after Tuesday, so it's everybody else's problem. But they didn't have no funding mechanism, and this is the same thing. Meeting with Tulare the other day, they do have a special district, and that's the reason they didn't have to have too much from the AG to tell them what to do, because they leased their hospital to Dennis Health, get that, so they could be open. And forming a district, I said on last, but when it takes a while, it's gonna take thousands of dollars, so we don't want to get too much of our ARPA money away because these studies are not cheap. To make one this big for the district, for the hospital, I think it's really important we do that. I've tried to do a few of these, and we tried to do the Measure L for our public safety for fire and CAL FIRE, and for our sheriff, and those idiots up there in eastern Madera County, the non-sayers and non-growthers that don't want nothing, they help defeat it. And then we did Measure T. They think roads are done, after 20 years, they're all perfect. Roads forever will have to be repaired. So that's one of the things they bitched about Measure T not passing it. It's very stupid because roads will always be in need of repair. And there was a clause in it that after 10 years or 15, they could still look at it and see if it wasn't needed and dissolve it. It wasn't like it was set in stone. It couldn't be dissolved. And they don't realize that now with all these electric cars and fuel efficient cars, that our gas tax money has dropped way down. And I know you want me to keep moving, but I want to tell people what it takes to get a district passed. It's really important. So myself, going off, I don't have much to say, but I'll be there fighting for it both ways. So we maybe not want to include Eastern Madera County, the special district for the hospital, because I'm going to tell you right now, they're against everything. And I'll name them. If you want to know the names, tell me and I'll give them to you because what I got for them. None of them lived up there like I've lived up there since 1958, and all these newbies, they're just NIMBYs. So you guys know what that is. So anyway, I want some directions from our board, and I think it's time we do move this forward. Turn it on. Oh,
Yeah,
Jay, you
I
want to say
think,
more?
I've kept track of what Supervisor Gonzalez listed out. I think we're pretty familiar with the direction the board would like us to go. I think Supervisor Poithers was in agreement with that too. So with that, we will move forward on those five areas. In terms of putting together a group, obviously we need to do some internal thinking first. So if people don't hear from us for a little while, meaning like if it gets to next Tuesday, you haven't heard anything, don't panic, please, because we're still working on getting background information. But as I mentioned, it's already agendized for your January 3rd meeting as a discussion item only. And I'm sure that we'll be having things on the regular agenda really soon, whether it's the 10th, most likely, versus the 24th.
You want?
No, and then I just wanted to thank the staff for coming together rather quickly and pivoting and coming together to talk about the services and how they were going to execute those, because that's vital for us, and we don't want to not serve our community. So thank you to the staff for coming together, and it's a tough week to do this when everyone's out, and but thank you, and thank you to our representatives for working on Christmas Eve, and because we want to see some type of success come out of this. So thank you again.
And I want to thank these two right here, because I know Rob's been doing a lot of background work, and Letty called me a couple of times yesterday, and she's had meetings almost all day yesterday with our congressmen, with our assemblymen and women and everything. And they even had a meeting last night, 7 o'clock Zoom meeting. So they have went overboard, and it's really hard right now because of the holidays. Everybody wants to stay home and don't do nothing. So it's hard to get a hold of everybody, but the 7 o'clock meeting last night with some of those people up there, thank you.
I was supposed to be in Monterey.
Yeah, but I thank you guys so much for all you've done to move this. And I know I'm stepping down, and but I'll still be involved with stuff, but I know that it's in good hands, and I know Bobby McCauley taking my place. It'll be in good hands because I got a big boot. If it don't, I'm sure I'm with this. So thank you, everybody, for coming. We're going to shut it down and adjourn this, and I hope everybody has a great New Year's. Please think positive on this.